All loving, all glorious God, we thank you for seeing us through the night to another day of life. We thank you for commissioners who today and each month of the year begin their meeting by lifting their hearts and minds to you in prayer, pledging their allegiance to you and your ways. We thank you for the public service individuals under their direction and employment, and all those who volunteer their efforts in creating and sustaining our gifted and caring community. We thank you for the faithful employees who will very shortly receive well-deserved service pins for their consistent and conscientious service. We thank you for our gifted citizens and pray you inspire us as we begin our early voting process today. Continue to enlighten us regarding the environmental, social, transportation, nutritional, recreational, and healthcare needs confronting our communities as we work together to address these. Grow in each of us the qualities of love that will enable us to carve out a better communal life for all, especially the neediest among us. Patience, kindness, humility, politeness, generosity, self-sacrifice, and forgiveness. On this 12th day of Black History Month, may we grow in our respect for difference and diversity. May we see and appreciate the skin color of all. And may we celebrate the gifts of our Black sisters and brothers of Dare County and the world. We make this prayer in your holy and beloved name. Amen.
Thank you, Dr. Berry. May we stand for the pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
County Manager.
Good morning, Mr. Chairman. Item 1 on the agenda is the chairman's opening remarks.
Okay, I got a few things to cover this morning, but as you know, I always like to start with a little humor. Seems this church minister comes out one morning to find a dead donkey on the church lawn. Well, he calls animal control, who then tells him they can't remove it without authority from the mayor. Well, the mayor of this particular town is about as rude and obnoxious as they come. And when the minister called the mayor, he didn't disappoint. The mayor began to rant and rave and go on for some time. Finally, the mayor tells the minister, "What are you bothering me for? It's your job to bury the dead." "True," replied the minister, "but I'm also obligated to tell the next of kin first."
That was a good one, Chief.
Just a reminder, I chair the Coastal Counties Fishing Coalition, and we had to postpone our meeting earlier this month due to the weather and the snow conditions. So we have a meeting. Our next meeting is March the 4th in Moorhead at 1 o'clock. So we're working diligently to support our commercial fishermen throughout the county and up and down the coast. So just remind folks that we have that meeting. The last night was a really, really good meeting in Buxton. I want to thank our board members, the county manager, the assistant county manager, Dustin Peel, for going down last night. It was a really productive meeting just to inform the citizens of Buxton of the upcoming beach nourishment and growing repair situation down there. They had a very good turnout. They had a lot of good questions, and I thought it was a very productive meeting for us. And we were certainly happy to go down and explain and tell them what our next steps are. For the board's interest, just recently, if you recall, we made another donation to the Children and Youth Partnership, and they sent a very nice thank you to the board. I'll share it with the board, thanking us for our generous donation to them again this year. So I want to thank the Children and Youth Partnership for recognizing that and sending us a thank you. And certainly last but not least, I have a presentation to make this morning, but just on behalf of the Dare County Board of Commissioners, it's an honor to recognize the Hatteras Island Cancer Foundation. And I'm going to present a certificate to the Vice President, Donna Barnett, in just a moment. 25 years of compassion, community-driven services to Hatteras Island. Since its foundation in December of 2000, the Hatteras Island Cancer Foundation has operated by a simple but incredibly powerful promise that no one on the island facing a cancer diagnosis should ever have to face it alone. Over the past quarter of a century, volunteers organized has truly delivered on that promise, providing assistance to 257 Hatteras Island residents by helping cover medical costs, prescriptions, and the often overlooked burden of traveling for treatment. Folks, what makes this organization especially meaningful is how it got its start more than 2 decades ago. The foundation was a vision of Lainey Howe, who moved to Hatteras in 1996 and was diagnosed with breast cancer shortly after she arrived. During years of treatment, her new friends and neighbors, many of whom she had only just met, stepped in to assist her without hesitation. They brought her meals, cleaned her home, cared for her family, and drove her to medical appointments in Elizabeth City and Norfolk. Lainey was deeply moved by the generosity of this new community she called home. And because of that, she made it her mission to ensure that the same level of support she received in her time of need also existed for others on the island who were battling cancer. She gathered friends, shared a vision, and by December of 2000, the Hatteras Island Cancer Foundation was born. Though Lainey sadly passed away this following year, her spirit, determination, and gratitude for this one-of-a-kind island community continues to live on through the foundation's work every single day. More than 25 years later, that legacy is evident in every fundraiser held, every volunteer hour spent, and every great grant made possible by neighbors helping neighbors. Whether through a chowder cook-off, a 5K, or a school fundraiser, or a generous donation from a local business or community member. Today, our board proudly honors the Hatteras Island Cancer Foundation for its decades of service, its unwavering compassion, and the profound impact its ongoing efforts have had on the lives of hundreds of families across Hatteras Island. We want to thank you for all that you've done and for all that you continue to do for the Hatteras Island community. I'd like to ask Donna Barnett, the Vice President of the Hatteras Island Cancer Foundation, to meet me down front. On behalf of the Dare County Board of Commissioners, we want to submit this, or present you with this certificate of appreciation for all that y'all do for the citizens of Hatteras Island. Thank you for what you do. You want to say a few words? No. Okay. Thanks so much, Don. Incredible work that they do, and once again, Donna, we're very, very proud of your organization and what y'all do, and thank you for touching so many lives. County Manager, that completes my report.
Chairman, that brings us to the presentation of the service pins this morning, and we have one this morning. If Jenny Collins would come forward, please, to get her 10-year pin.
Oh, finally, you get to do that.
Wait, what?
Wait a minute.
Good morning.
Good morning, Chief.
Good morning.
So you all know Jenny. She's here for us to get her 10-year pin. I'll tell you a little bit about her. We've got a 40-year veteran here. She started her career, I guess, when she was about 10. But in 1985, she started working up in Prince William County Fire as a technician. And then through her career up there, she worked her way up as a lieutenant, and then later a captain, and then later the battalion chief, the executive officer to the fire chief. She ran EMS operations. She ran their health and safety, their training, their HR. And so she performed pretty much all the roles for that large fire department EMS side that she does today. She came to us in 2016. We were lucky to get her. She came here because she wanted to be here. She could have gone pretty much anywhere she wanted, and she can probably go anywhere she wants now because people have tried. And so we're glad to get her. When I think about her and her job and her role, I think, well, what does the EMS director do? Well, she's got over 100 employees, 9 buildings, 1 helicopter. Not many people get to say they manage a helicopter. She's got hundreds, if not thousands, of pieces of equipment that she has to keep and maintain and inventory and replace and all those things. She has to train all that staff. She has to keep them healthy, keep them safe. She does all the compliance, all the things that we have to do to keep the EMS department compliant, to keep all of those people compliant with all those rules. Believe it or not, she does a ton of the legal stuff because all the contracts for all that stuff that we have and all those things that we do run through her before they get to me. They're vetted multiple times before I even see them. Billing, all those patients, those hundreds of people that we see we have to bill for that. And so there's a whole section that we do that just sends out bills and collects those bills and does the work that we do there. And that list goes on and on and on. And so that work is done seamlessly by her and her staff, and through her leadership, we don't have significant problems. We come to you every year with her budgets. They're in line. They're not always what we want to hear, but they're always there and they're always right, and the work is well done. It's done professionally. It's done correctly. and she's a true professional in all of those things and in all of those ways. Her role goes further than that as just the director, though. She's a mentor to those people. She's often the disciplinarian to those people. She's their friend, sometimes their mother, and sometimes, the advocate for things that on behalf of the people or on behalf of the department. And again, all this is done with professionalism, with humility, and with great care and understanding of what her role is. As we go through and do these pins, we often talk about what do people do in their spare time and what are their life. And I have to confess, I don't know if I know. I know that she has a son who's in the Army, and I think he's trying to become a helicopter pilot, so he's working through that right now. I know that she has a house and a beautiful yard, and she likes to piddle in her yard. But really, she's an EMS person. Her life is EMS, her role is, and it's what she does. It's not unusual for me to get a call at 7 o'clock at night, 10 o'clock at night, a text at 4 o'clock in the morning, whatever, telling me something that's happened. A truck hit a bear on the way back from Greenville at 3 in the morning. We have an issue with the helicopter. It's down for some reason. Whatever the need is, it's always there, and it's 24/7. And so I guess what she does in her spare time is what she does 24/7. Is she's an EMT and an EMS director, and that's what she does. And I can't say enough good things and how delighted that we are to have her. She's taken our department to a new level. I would say we have the premier EMS services, certainly in Eastern North Carolina, but I would put it up against anybody in the state, large or small, and we do a great job and do a great job for our citizens here in Dare County with that, and we appreciate your 10 years. I don't know how many more we got. I hope it's a bunch, but thank you so much for all your hard work.
Thank you for your support. On behalf of, Bobby and the support with county management, but we couldn't do what we do without the support of all of you up there, and we very much appreciate it. Thank you.
Well done, Chief.
So that brings us to item 3 on the agenda. This is a presentation by Sandy Pace for the 2026 Dare County Special Olympics Polar Plunge update.
Yes. We need one hat for Miss Mary Ellen. Bring a hat. She plunged before. That's right. She's going to plunge again.
Introduce your team.
We're going to get everybody's coming up.
Introduce them.
Yep. Come on.
Don't be shy, folks. Come on up here.
Come
It's a
on.
big day.
Yep, because we're going to make a line eventually right in front of there.
Okay.
All right, come on up. I'm going to introduce everybody real quick, and then they have a little presentation for you. But I also just want to say thank you for your continued support for our program and our amazing athletes, and what we can offer to them in Dare County is absolutely amazing. We do a lot of things, and we wouldn't be able to do that without your support and the support of our community. And the Polar Plunge is our it has become a huge community event, but it is our big fundraiser for the year, to where we don't have to worry for the rest of the year, if we do this right, about our financial support. As you guys know, athletes are never charged anything. All of their uniforms, all of their equipment, any rental fees we have, any transportation fees, any meals, any special events we have, they never get charged for anything. So we raise all of that money, and it's all done by volunteers. Nobody is getting paid, so it's an amazing, amazing thing. And our community, honestly, is the best to live in, and we have the greatest support. And just real quick about the Polar Plunge, you can still register. You can go online and register. Dare County has a place. You can go to their website and register. You can register the day of until 10:45. It is February 28th. The opening ceremonies will start at 11. We will have law enforcement there. We will have the North Carolina Highway Patrol will be there. The U.S. Fish and Wildlife will be there with some of their rescue swimmers, trained rescue swimmers in the water. I have just been recently told the U.S. Coast Guard will actually be there with some of their rescue swimmers, and they're going to do a helicopter flyby. So we are getting bigger and better every year. Right now, we have about 280 people registered to take the plunge. It's typically over 300. We do it in 50-person increments. And so for safety reasons, everybody has to do a check-in. Even if you register online, you're going to get one of these color-coded OBX Polar Plunge wristbands. Everybody that registers will get one of these nice I Plunged at Jeanette's Pier shirts this year. And so, and there'll be raffle prizes. Everybody that is registered gets a raffle ticket. There's prizes given, and there's also prizes given for costumes, and just trust me, if you're not going to plunge, you need to come and watch. And our motto is, if you don't plunge, you have to pay to get out of it. So if you're not on the team, then you have to show us the money. So anyway, our goal this year is $60,000. We're at about $42,000, so we have a little way to go. So hopefully we'll get there. We've been lucky the last several years. We've met our goal, and I'm just going to introduce some of these guys to you real quick, and I'm going to line them up because they have something to say to you, but they're going to use the poster boards that they made to say it to you. So over here we have Mike. He works with Monarch Beach Club. This is Ellen. Hey, Ellen.
Hey, Ellen.
Lena. Ronnie.
Shane.
Joelle.
K.E.
Kathleen. Mary.
This is Boo. Dottie. Okay, these are some of your athletes and some of the amazing volunteers and workers that we have. So we're going to start a line, guys. Line up in front of the podium. We need 9 people. All the athletes get up there. One of our people were sick, so several of the other athletes weren't able to make it today.
Got enough?
1, 2, 3, 4, 5, 6, 7. Mary, go up there. 8. K.E., you want to be the last one? All right. You take this one when I tell you, you do it. And who's first over here? Ellen? All right, Ellen, when it's your turn, you're going to turn that around, okay? All right, Ronnie, you take one. Jane, you take one. Don't turn it around yet. Don't turn it around yet. Surprise. It's a surprise. Mary, one for you. We got one more here. Okay. All right. Go ahead. Ellen, turn yours around. One at a time. Ellen's going to do yours. All right. One at a time. One at a time. They each have a message. Hold it up. Hold it up, Dottie. Turn it around. All right, go ahead.
Okay, got it.
Okay, you hold yours. This is their final message.
We dare you.
Dare you. All right, come up here. We're going to line up pictures. Turn around, Dottie. We're going to get a little picture with them behind us.
Stand, guys.
So they can see who did this last year.
That's right.
There better be all of
Yeah.
us. That's right.
No, I'm good.
2, 3, everybody cheese. Awesome.
Mary Pendle, those emergency rescue swimmers are there for you.
Remember, if you ain't plunging, you're paying.
That's right. That's right.
Cold for gold. I like that. Reason for a reason.
Oh, yes.
You ready, Mr. Chairman? Okay, Mr. Chairman, that brings us to item 4. Item 4 is public comment. Before we go to public comment, if you received an award this morning, please go right out here through the door so that Caitlin can get a picture. And we'll take a second and let everybody who's leaving get out. All right. Ladies and gentlemen, now's the time that's been set aside for public comment. If you have public comment this morning, raise your hand. I'll recognize you. When I do, come to the podium. Say your name and where you're from. Please limit your comments to 5 minutes. There's a red light on the podium that will come on when your time begins. There's a yellow light that will come on when you have about a minute left. And when the green light comes on, you need to conclude your remarks. I have a sign-up sheet here, and who I have on here first is Robin Fountain. Please come forward.
Good morning. My name's Robin Fountain, and I live here in Manteo. Well, it's been a wonderful morning, actually. I thoroughly enjoyed the invocation, the humor, and the uplifting stories we've heard this morning. So it's with some regret that I have to change the mood. I'm so sorry. But I'm here to talk about ICE and CPB. The frankly outrageous conduct of ICE and CPB agents during recent enforcement surges in Minnesota, Maine, and Illinois has led to widespread public concern about poor leadership, inadequate training, unscreened recruitment, and lack of accountability at these agencies. I believe most Dare County residents would agree that it is not in our interest that the scenes of lawlessness and chaos that we have witnessed in these cases be repeated here. Dare residents may disagree with one another about the morality of immigrant detentions and deportations, but I doubt any wish for federal law enforcement to be conducted unethically, nor would they wish local law enforcement to be diverted from its mission of protecting and serving our community. I therefore request that the Board of Commissioners move proactively to adopt measures that prohibit ICE and CPB agents from concealing their identities with face masks or unmarked vehicles, require officers of these agencies to display badges, and ban 287G agreements which allow local police to act as ICE agents. Thank you and good morning.
Any other public comment this morning? Anyone else like to speak at public comment? And I understand we do not have any public comment from Buxton, so we'll move on to the next item, and it'd be item 5 on the agenda. This is a presentation. It's the front door of the county health care, strengthening the safety net to reduce overall health care costs to the community. And Lynn Jenkins is here for that presentation. Hey, Lynn.
Good morning, and thank you so much for having me, Board of Commissioners and Chairman Woodard. Let's see. Here we go. Okay, so I'm the Executive Director of the Community Care Clinic of Dare, located in the old Outer Banks Medical Building in Nags Head, and we serve people who live or work in Dare County. And we have 2 locations. Nags Head is our main location, and then the health department gives us some in-kind space in their building down in Frisco, where we are. So next slide. Do I change those here? Let's see. Okay. So a little bit more about who we serve: uninsured and underinsured. Underinsured means someone's health care premiums, deductible, cost more than 10% of their annual income. We consider them underinsured. They may have just a catastrophic plan. Again, live or work in Dare County, and the household income limit is less than 300% of the federal poverty guidelines. To give you a little reference, that's a single individual making less than $47,800, or a family of 4 combined income less than $99,000. Our patients have a lot of clinical needs: diabetes, hypertension, high cholesterol, and if there was no community care clinic, they are high emergency department utilizers.
Lynn, I'm not going to stop you for just a brief moment. We've
Sure.
got a discussion coming up about ThriveOBX.
Yes.
And in the course of that discussion, much of their theme, much of the premise is a healthier lifestyle. I'm looking at these clinical needs, and my question is, do we offer any sort of counseling work or advice to patients, or is it
ton.
merely, okay?
A
that's
ton.
what I
We're going to
wanted
get
be sure.
there.
Thank you.
Yes. So 90% of our patients are employed. 10% are primarily caregivers of their family members. The folks who come to see us work in, a lot of them in the hospitality industry, in the restaurants, hotels, construction, landscaping, fishing. We have people across the board for in jobs. Last year, in 2025, we had over 16,000 patient encounters in all aspects of our clinic. Next slide, let's see, there we go. So again, if there was no community care clinic, people would be going to the local Outer Banks Hospital emergency department. There's a federal law that says the ED must treat you and stabilize you regardless of your ability to pay. And so that's where people go if they can't afford care. So what we do is we prevent those unnecessary ED visits. We take care of people upstream. We're doing screenings, we're doing prevention, we're doing education and management of chronic disease. If someone is sick and they're one of our patients, we can get them in that same day. And that, so things don't escalate to an emergency level. Our new dental clinic that opened in the end of 2023, the number of walk-ins that come from the hospital, from the urgent cares, from other dental offices, we have at least 3 to 4 people per day that walk in with a swollen cheek, an abscess, pain, and they are taken care of. It's treated, not just like it used to be. In a lot of cases, somebody would walk into the emergency department and get a pain medicine, an opioid. We don't prescribe any controlled substances at the clinic, and an antibiotic, but that problem would come back because that tooth is still going to need to be treated. We've added behavioral health so that mental health episodes don't get to an acute emergency level. Our affordable pharmacy was added in 2022, and we provide mental health meds, physical health meds we ask for a contribution if someone can afford a $5 contribution for a 30-day medication or a $10 for a 90-day. We have insulins. Prior to us having the insulin, people were sharing with family members. It just was too expensive. And we've all heard how expensive inhalers are. Some of the mental health medications that cost $1,500 a month for schizophrenia or bipolar, and so they are affordable. We serve in the pharmacy, somebody who has Medicare without Part D, they can use our pharmacy. They can use our dental clinic because Medicare doesn't cover preventive dental care. So we have a lot of seniors on fixed incomes that are using our clinic. You can pick and choose the different departments that you use. And in this slide, you can see the difference in the cost from using an emergency department for one of these regular primary care, preventive screening, pharmacy, any of these, versus what it costs at the community care clinic. And that cost comes back to the county. All of that bad debt, all of that, and it clogs the emergency department. We want to be able to, if we have a true emergency, we want to be able to get in and make sure there's plenty of space in there. Next slide. There we go. So here is Chairman Ross, Chair Ross, what you are speaking to is the education, and we do a lot of education. We have a nurse educator who is certified in its medical, nutrition, and how food works with chronic disease. We have a health coach that is volunteer, and then our nurses and nurse practitioners and our medical director, Dr. Erin Baker, they also do education. Right after the appointment, so somebody gets a diabetes diagnosis, We teach them how to use insulin, what exercise does to the body. It acts like insulin, taking the sugar into the cells. And we give them a blood glucometer, a take-home blood pressure cuff so that they can monitor, save daily logs, bring those in, discuss those. In our lab, we can do a point-of-care A1C test, which shows you your blood sugar over 3 months. And then we work with LabCorp at a discount, fortunately, to do, we provide labs for folks. If they were going to the Outer Banks Hospital for those labs, that would be very expensive self-pay. They probably wouldn't get them. So we do a lot of proactive screening. Every patient gets a depression screen. Every patient gets diabetes A1C, blood pressures, cholesterols, and so on. And then we manage those we're really the only clinic in the Outer Banks that provides comprehensive diabetes care, from diagnosis to medication to diabetic foot care by retired orthopedic surgeon Dr. Glover. Health education for diabetes, the whole gamut. If you have people that are uncontrolled diabetics and they go into a hospital in a diabetic coma, or their blood pressure is so high they have a stroke, these things cost a ton in patient hospitalization, from $10,000 to $50,000 per admission. We are saving our county and our hospital those admissions by taking care of people upstream so things don't get to that point. Let's see, next slide. So our dental services impact has been really great. Prior to the community care clinic opening the dental clinic in-house, there was not a safety net dental clinic in the northeast region of North Carolina. There is a clinic in Terrell County, very limited, a couple of days a week, often not accepting new patients. So the dental clinic impact, and our patients do pay for dental services. It's on a sliding fee scale based on your income. So they are invested in their dental care. Last year in 2025, we performed a value of services. It was $562,526 value of services, and those prices are already discounted off of what the private dental clinics charge. And we donated, the clinic itself donated $261,000 of those. So we just ate that cost of care, but we're still paying our dentist market rate. And they make a little less than a private dentist would, but we still have to hire hygienists, dental assistants, purchase all of the supplies, lab cost. And so it's an expensive endeavor, but it's very worthy. We treat the underlying cause, and we provide prevention and oral health education, which is huge. You wouldn't believe that some people were never taught that you brush your teeth every day, especially if they're in their 40s and they've never been to a dentist. So we are approaching this with a lot of education, a lot of oral health education. The reality, again, in the emergency department, when people enter there for an abscessed tooth, they're looking for symptomatic relief, an antibiotic to slow down the infection, and a pain medicine. And we all know that's not where we want people to begin that journey that sometimes leads from a pain medication into other things. And again, also, it's a 3 times higher cost just to go to the ED to get those symptomatic relief versus coming to our clinic. So one thing, we're stopping opioids at the source for those folks, and coming soon, getting ready to kick off, we are going to add preventive services for children 12 and under who are uninsured children of our uninsured patients. It's amazing that there are a lot of children that are not on Medicaid or private insurance. And this way, when they're 20 years from now, their mouths are going to be healthy and they're going to understand. The medical value, we provided last year, just to give you some reference, it was over $900,000, and the average wholesale price of pharmacy prescriptions we dispensed to our community last year was over $2.5 million. And that was 6,500 and some prescriptions. Next slide. Cancer screening and early detection. Again, it's much less costly to treat a stage 1 cancer than a stage 4 cancer. And if you don't have screening, you're going to present to the hospital when it is symptomatic and you're in a later stage. So we provide screening for colorectal cancer for all adults 45 and over. Oropharyngeal cancer, the only way to screen for an oral cancer is by a symptomatic oral health exam by a dentist. So if you don't have a dentist, you're not getting screened. And the oral cancers in our county are higher than the state average. So it's very important, and it's very debilitating to have a head and neck cancer. And our dentist works with the hospital oncology department. When they have a new head and neck diagnosed patient, they send them over to her if they don't have a dentist, and she evaluates and tries to take care of as much of the dental services as they need, because they can't start radiation until all of that is taken care of. And so our dentist, Dr. Rago, has agreed to do that for their patients. And then prostate cancer for men age 50 plus. And then we can help people get to the specialist and help them with financial assistance through organizations in the community or financial assistance programs like Charity Care. Next slide. Comprehensive diagnostic access. We have a partnership with the MRI CT Diagnostics. They donate CTs, MRIs, ultrasounds, and x-rays to any of our patients that need them, because they know that we are determining eligibility and with every patient every year recertifying, showing their household income, their pay stubs, their tax returns. And that is saving our hospital and our county a lot of money. And then you can see just some numbers of labs we performed, imaging, 31 CTs last year at about, 2,000 or so per one. That's a picture of our lab. We'd love for you to come and take a visit and a tour. Next screen. One thing we started in the last couple of years, Mr. Bateman was very instrumental in this, is we offer Vivitrol now. That is a injectable naltrexone that suppresses the craving for alcohol and opioids, so that someone can have these injections linked with counseling. Maybe after 9 to 15 months, they're completely drug-free. They don't need to go to the Nags Head Treatment Center, no methadone, no Suboxone. They are completely drug-free. And we have seen some great success with this. And we offer the substance use counseling as well. And you can see it's a reduction in justice encounters for these folks. It saves them per year. It improves people's quality of life. Next slide. We address the social determinants of health at every single visit. That is, do you have food insecurity? Are you safe at home? Do you have transportation? If not, we give out transportation vouchers for Dare County. We've had to get some Uber health rides for people or a taxi. And we do that because we know that if they can't get to the doctor or to their specialist visits or their CT exam, they can't get healthy. And all of that goes into our health. Every other Monday, if you want to come and have a feel-good event, come work one of our food distribution events with the Albemarle Food Bank partner. 100 families at least show up, and this is all grocery surplus from our local grocery stores after the weekend, and it's fresh vegetables and meats that would otherwise just get thrown out. And it is it helps people budget and have access to healthy foods, which works in turn with our education. And we have interpreter services, which is safer for us to give care that way. All of our prescriptions have a label for any Spanish-speaking or English as a second language person who speaks Spanish in both Spanish and English. They put a label on the over-the-counters that we dispense in Spanish and English. And just avoiding emergency situations by having good information. And then the second to the last slide. Next, here we go. So the financial impact. We determined, and I think this is a little low, that ED diversion from the emergency department and avoiding hospital admissions comes to about $7,800,000. And we are very, very grateful for the $100,000 that the Dare County Commissioners contributes to the clinic each year. We are very grateful for that. But if you look at the percent of savings relative to our nonprofit total budget, which is about 1.7 million now is our budget, that's a great social return on investment and return on investment of 367%. So for every $1 you are investing in us, we are able to provide almost $5 worth of services. And saving the taxpayers a lot of money, the hospital, and the last slide, I would just say we appreciate your leadership in advancing fiscally responsible, equitable health for our county. You can see how many volunteer hours we have. Last year, over 2,400 volunteer hours, plus our 16 part-time staff and 10 full-time staff. And we would love for you to come for a clinic site visit to see everything in action and consider upcoming budget requests to maximize the county savings and continue to improve the community health outcomes. So I thank you so much, and really seeing things in action, I think you would be happy with where your money is going and that we're being good stewards of that funding. Any questions?
Thank you, Lynn. What great work you guys are doing. It's just incredible.
Well, thank
Appreciate
you.
it. I asked the board if they have any questions.
I do, just one. How many people are we missing, Lynn?
How many people are we missing?
You treated 16,000 patient encounters.
That's 16,000 encounters with a little over 2,000 patients. We are missing thousands.
That's my question. And I always try to put these things in context, because on an absolute terms, it sounded fantastic, and it is. But in a relative term, in the overall county, how much?
Yeah, well, I can give you
Or
some
maybe we don't know.
examples, personal examples. I have a child that is a fishing mate at Oregon Inlet. And he does other work in the bluefins in the winter. But his insurance premiums in the marketplace went up a ton this year. I mean, he said, am I going to really spend $600 a year on insurance for a healthy 20-something-year-old? Probably not. So we're seeing more people come to us since they've done their marketplace insurance applications, and they're saying, we can't afford this, so we're dropping this. So now we have this gap up at the top of our income limit of people that last year were insured and this year they're not insured. Or they said, we'll just go for the catastrophic bronze plan in case we're in a car wreck. So this young group, like in the 20s to mid-30s, in the last community health needs assessment, and I think I'm getting this right, there were 34% uninsured in that young healthy group. So they aren't getting preventive screening or labs or health education, so they're going to be in the 50-year-old group. Like I said, we're seeing more seniors because they don't have preventive dental services, or they can't afford their Medicare Part D, or the co-pays on these drugs are huge. There's some drugs that can get donated to us, like Eliquis, which is a really expensive medication, and then we can get those right back out to the community. So we're now seeing a broader range of people that are uninsured or severely underinsured, and And we have capacity to expand. Right now, our medical clinic is open 9 to 2, Monday through Thursday, and alternating Monday evenings with Dr. Baker. We have nurse practitioners that do want more hours. We just added telehealth in our Frisco location, so we can open every Thursday in the month and have people come in for follow-ups using telehealth, which is a very inexpensive way to provide health care. And we're grateful for our state grants. That was through an Office of Rural Health grant, the telehealth. We team with Trillium Human Services, which is the mental health statewide organization, helps us get mental health medications for folks, and counseling for individuals in our community who English is their second language. There's a lot of fear and a lot of anxiety in that population right now, as you can imagine. And we're able to help them because of some of that Trillium state money, which is wonderful. But there is a lot. The state does some, you all do some. I get grants from some foundations. Patients pay their part. We do a big Billfish tournament fundraiser every fall. We have Southern Bank, Twitty, Town Bank. They are all contributing to us annually each year. But it's a big budget. And it's constantly writing grants, and it's competitive. The state grants are competitive. So if one organization in a community gets one, the other organizations that are writing for those grants probably won't get them. So I just appeal to you all to think about that, and appreciate everything you do and all of your support, and come see us.
Absolutely. Thank you, Lynn.
Thank you. Thank you for your time.
Chairman, that brings us to number 6 on the agenda, and this is a ThriveOBX presentation, and Dr. Sheila Davies is here to present that.
Good morning, Sheila.
Good morning, everybody. In front of you at your seats, hopefully you have a Thrive booklet. Do I have one? I'm excited to share that we are in the midst of Thrive Month. Hopefully you guys have heard about this before now. We were hoping, before the meeting obviously had to get moved, that we would be kicking off the beginning of the month. You have a month to complete activities that count towards prizes. This initiative this month is really to kind of kick off the whole ThriveOBX initiative. As Commissioner Ross indicated, ThriveOBX is basically a community initiative where we're encouraging people to, take a deeper dive into looking at ways to improve their health and well-being. In the back of the booklet, there's a little card here. This is a way to track the activities that you do. A lot of the activities are just honor system, and they're activities that you can do on your own time. The booklet describes a lot of those activities, but there is a stand-up website now. I think Matt's going to help me try to pull that up. ThriveOBX.com is the website that covers all ThriveOBX information. But specifically on this website, list can guide you through activities that are happening throughout the month related specifically to Thrive Month, and that can be tracked on this card. Some upcoming activities. This coming weekend is a move-a-thon at 3 different locations from 7 a.m. to 7 p.m. It's also Valentine's Day, so you could take your sweetheart and drop in and do some movement activities. But at the Tillett Center down south, I think it's at the Baum Center, and then at the First Light High School. They're doing activities. Just you drop in, you do movement. There's going to be special events throughout the day, but on the website there's a full calendar as far as being able to navigate the activities. If you don't have a booklet, you all have a booklet, but there may be people in the community that are watching that don't have a booklet. There's a way to order a booklet, and it would be shipped out immediately, so you'd get it hopefully within the next couple of days. To your house. They're $10 for the public to purchase. The money that's raised this month through ThriveOBX is actually going to go back into supporting activities to support Thrive. So it may be that the school applies for a grant, and the money that we're raising through this would go towards that. Outer Banks Health is kind of the fiscal managing agent as well as the lead partner. And as you all know, we've talked about this before, Dare County is also a lead partner. We're working very closely with Outer Banks Health on this initiative, not just for Thrive Month, but ongoing, ThriveOBX. As far as what the county's doing to help support that initiative, we have formed a group of liaisons from each county department. Skylar actually gets to represent you all and will be your liaison to share information about ways to engage in ThriveOBX. But we have representatives from all the different county departments, and we will be working together to encourage our Dare County employees to embrace this Thrive initiative. You all know it's been pretty extraordinary what's happened over the past few years when you look at Dare County employees and the investment that's been made in wellness and how that's contributed to lower healthcare premiums. We've had, when it's come to budget time, year after year, the past few years, our rates have not gone up. That's pretty extraordinary in the marketplace right now, and it's really, I think, a direct representation of the investment that the county's made into well-being initiatives, whether it's the Center for Healthy Living and our wellness program for employees, the initiatives that we do that HR puts out. So this ThriveOBX initiative is now to take that to the broader community. Keep what we're doing, get more employees engaged. We have over 100 employees that have purchased the booklet. For employees, it was a $5 discount. So not sure at the end how many will be able to complete their card. But I hope that you will. You'll see if you look at the card, it's very doable. There's a prize if you just complete one activity in each of the Thrive categories. There's a different prize if you do a couple of activities. And then if you can complete the entire scorecard, which is only 20 activities, then 25 activities, then you get another prize. So the way that you'll redeem the prizes at the end is you'll get an email, and then you'll respond to that and be able to take a picture of your scorecard, and then Outer Banks Health will be in communication about retrieving those prizes. So I encourage you to take the challenge. There's things that you're already probably planning on doing. Those of you who are taking the Plunge for Special Olympics coming up, you can actually get credit for that under the MOVE initiative. So there's things that you're already doing that you can check off on your scorecard. You missed the chowder for the Super Bowl, but you can create, there's healthy recipes. You can make your own chowder. And check off a box for doing that. So lots of fun ways to engage. We hope that you all will do it, but we also really hope that the broader community will engage. Again, this is specific for the month of February, but then we will be keeping this initiative ongoing, and that's what we'll have the county employees helping us do throughout the year. So I'm available if you have any questions.
Any questions of Sheila?
No, this is great.
Yep.
Right. Thank you.
Good. Thank you, Sheila.
Chairman, that brings us to item 7 on the agenda. This is a MOU between Dare County and the Tourism Board with regard to the pickleball project that we're doing. I think you all approved the project, approved the funding at the last meeting. We told you we would come back to you with an MOU that sort of sets up the arrangement. This is a 10-year agreement with them. It has 10 one-year renewals, common renewals. The idea of having a 10-year sort of sunset where you look at it again is to make sure that in 10 years it's still something that's popular and still something that's useful for the property. I've used the example before, but when I was in college, racquetball was a big deal, and everybody had racquetball courts, and they built tons of them, and now nobody plays racquetball. And so pickleball is a big deal now. We're going to invest in it and move forward with the project. But in 10 years, if it's not viable and not active, then maybe we need to make a different use of that property. So there's a 10-year term on it. It will be operated substantially as if it's part of our rec department. So we're going to manage it, maintain it, book it, make all the rules, do all the things that we need to do to keep it operating. Their role is to provide the land and provide the funding. It provides that, they got to reserve parking for us when they have events so that the events don't push out the pickleball. There are right now 6 events a year that will push out the pickleball, and that's in the agreement because they need the parking for those big events. And so 6 times a year, there could be some issues.
Got
there.
to reserve parking for
But
us
don't,
when they have events so that the events don't.
Here we go. So that's what it says in there. You all have it in your packet, you've seen it, but that's sort of the 10,000-foot view. There is one modification that we're going to add. It's very minor. They asked that we put in there, we would have done it anyway, but to put in that we were going to be responsible for putting the trash cans in and picking up the trash. Well, that comes with operations, and we would just do that. So I'll add that to it. But beyond that, this is the agreement that, at least at the staff level, we've agreed to. It's been to their, their executive committee? I'm not sure what they call it, but they have reviewed it and approved it, and it'll go to their board in this form later this week. And so need for you all to approve. If you have questions, I'm glad to answer them. If not, then I'm seeking approval of this MOU.
Okay, is there a motion to approve?
Motion to approve.
A motion to approve by Commissioner Bateman. Is there a second?
Second.
Second by Commissioner Burris. Floor is open for further discussion.
Bobby, just one or two quick. When I was last at the tourism board meeting, they said there were a couple of hiccups in the MOU that they needed to work out.
That was it.
That was it? Okay. And number two, we have a not to exceed cost, and then we have the procedures for covering the not to exceed. Do we have any indication or confidence that the not to exceed will not be exceeded?
I don't have
I'm playing
confidence.
off of recent experience as we discussed in the car last night.
I don't know the answer to that. I mean, I would say there's probably a 50-50 chance either way. I mean, that's been our experience so far. That's why we've got a mechanism in there to deal with that. If it was to go over, then we don't have to do it. If it was to go over, then we would have to have a discussion with them as to how we're going to cover the
Another
overage.
discussion.
I just wondered if we had, oh yeah, we know it's going to be that, or.
No, we'll have another discussion.
Yeah.
We didn't, I mean, these are numbers that were given to us from, it wasn't, I don't think it was formally bidded, but the engineers went out to the contractors and got numbers. So they were not wags when we got them, but again, until we put it out there to actually do it, you don't ever know what you're going to get.
The maintenance says there are 8 parking lot poles with lights. Are they lighting the courts or just the parking area?
So right now, those parking lights don't work at all, and they don't use them or need them. But we have this set up where it can go to, I think, 10 o'clock at night, and so, or 9 o'clock, 10 o'clock at night. And so there will be some times when it's dark and those lights would light the parking lot. We believe it's a simple matter of when they tore down the old restaurant there, they just cut the power line. And
Sure.
We need to reconnect that power line. That was,
But that illumination will cover the courts. They can play after dark.
that illumination will cover the parking lot. The courts in part of the project will be lit.
Okay, that's all I needed. Thanks.
courts will be
Yep,
lit, too.
got it. Okay.
And they have an ordinance on their lighting, if you recall.
Yes, I do.
Okay,
Not too much light.
right.
I got a question as well.
Yes, sir.
So it says in the maintenance part of it that the tourism board's going to be responsible for the maintenance, but we're responsible for the operation as far as staffing and facility. Well, if our people are staffing it and they're doing the maintenance,
No.
So
No, we are.
No,
the pickleball part is part of the overall
I'm
facility.
just looking at this right here.
Okay, right. And so what we did is we singled out the pickleball as the county will maintain that through our rec department. The rest of that event site, the roads and the signage and all the other stuff that is there that's needed for us to get to the pickleball courts and all that will be maintained by the Visitors Bureau.
Okay.
that answer what you're looking for?
Yeah,
Commissioner?
so I just wanted to make sure that our staff, if we're staffing it, I wanted to make sure that the maintenance and all was something different, which obviously it is, roadways, lighting, everything else. We're good.
Okay, anyone else? Okay, those in favor of the motion, please signify by saying aye.
Aye.
Aye, opposed, like sign. Motion carries unanimous. Thank you, gentlemen.
All right, that brings us to item number 8, which is a Parks and Recreation tax referendum. At the last meeting, we talked and we discussed the Parks and Rec plan. We discussed some ideas about how to fund it. As you know, we paid to have a study done of our Parks and Rec system, and that study indicated that we needed some significant improvements to meet what we believe to be the citizens' stated needs for our Parks and Rec program. Those numbers were over $50 million. We've had some conversations about our capital improvement plan. The capital improvement committee has met and looked at this and other things. And the long and the short is there's not $50 million in the capital improvement plan to do these things. And if we were going to try to do this over time out of the budget surpluses, if we had surpluses, then it would take many, 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 many years to accomplish those goals. And so the idea was, how can we find a way to fund this in a relatively short time without putting a tax burden on the ad valorem taxpayers of Dare County, and at the same time meet what they say their needs are for recreation. And the idea came that there is a provision in the North Carolina statutes, it's in GS 105-537, that allows for a quarter of a penny sales tax to be added to our current sales tax, which would then raise the sales tax that we currently pay from 6.75 cents to 7 cents even. And there's some slides in the deck. That sales tax would provide roughly $6 million a year in revenue. That $6 million a year would allow us basically to borrow the whole 50-something million, $57 million we need to do the rec program, and that revenue would cover that, and it would also cover a part of the operation cost too. So it would come to us, and it would basically fund what the report says we need to be doing for parks and recreation. Now, so the idea is, in order to have that tax, is you have to have a referendum, and the people have to vote for it. And so the statute says we can put this on any general election, and so if we were going to do the referendum, then it would go on the agenda or the ballot for the November election coming up, and it would be voted on by the people. So let's talk about the tax just a minute. Again, I told you it would generate roughly $6 million. It would fully fund and operate the rec program as expanded under the model, under the report that we got. That money substantially is paid by our visitor community. We estimate that roughly 70% of those tax dollars that come into Dare County are paid for by the visitors, so they would be funding a significant portion of what we're doing. And the tax excludes multiple things. It doesn't tax your food, it doesn't tax your car, it doesn't tax gasoline, it doesn't tax medicine, it doesn't tax prescription. So mainly, most things that you do out of your budget wouldn't be taxed by this. Your mortgage isn't taxed by this, and so a substantial amount of your budget would not be taxed. Matt went in and ran some estimates. The estimates were that it would cost an average citizen roughly $14 per year, or 27 cents a week.
That's just over $1 a month, if my math is right. Is that right, Matt?
Yep,
Okay.
that's
to
correct.
fund this. And so, again, it would be a minimal burden to the taxpayers. It would be significantly less than if we tried to do this out of the ad valorem tax, where our local taxpayers would pay 100% of the cost. In this particular case, they're going to pay, roughly $12 or $14 a year, and then the balance will be paid by our visitors every year to cover that. So it's a good way to do it with minimal impacts, and if the people in the community want these recreation programs, here's a way we can do it in an affordable and responsible manner. And all it takes is them, if they're supporting the rec department and the expansion and the programs that they say that they need, as they said in that report that was done, then they need to come out and support this referendum. If the referendum is not passed and people don't support this, then this project can't be done. In the near future, there's not that kind of money available or the ability to borrow that kind of money and do the things that we have to do going forward that have already been programmed and planned and take higher priorities. So that's where we are, and what we're here for today is, one, for you all to have a discussion about that, share your thoughts, and then secondly, if that's something that you want us to proceed with, then so direct, and we'll move forward to get that going with the Board of Elections and get that on our ballot. And then, you can talk about, we aren't allowed to financially support promoting it one way or the other. The county can't fund billboards, advertising saying support the bond, but you all as individual elected officials can support it, do whatever you want, or not support it. If you don't support it, you can say whatever you want. So, and again, we need to, if we're going to do it, we need to get the community behind it so that we can do it.
Bobby.
Go ahead.
Excuse me. Bobby, we have, before we get into some questions and comments, we have the chairman of the Parks and Recreation Advisory Council board here today, Justin Bateman. Justin, would you mind coming forward? And I'm going to ask you something that if you can share with the board. I know your advisory councils discussed this. Is your advisory council in agreement with this proposed quarter-cent sales tax?
Absolutely, 100%. Yes, sir.
Great. Now, just, they're our advisory council. They tell us what we need in the Parks and Recs area, and just wanted to make sure we had their blessing with this.
Absolutely.
Thank you, Justin.
Yes, sir.
So that we're not talking in the abstract, let me just run through real quickly what the critical needs are and talk about where this money would go.
That's where I was going. Please.
This may not add up to $56 million, but this is the big ticket items that are in that. And the first immediate and priority need is fields, and the way that the consultants say that we can get more use and more activity on our fields is to use synthetic turf. That has been done in many places. It extends the life, gives you 24/7, 365 use of the fields and that, and therefore you can schedule things. You can schedule multiple activities on them. You don't wear the fields out. You don't have to close them. You don't have to plant grass. They're expensive. I mean, we're estimating, $4 million or more to cover those costs. There's some indoor expansion up all the park, Westcott Park, and the Northern Beach Division, the Pheasant Center, all need expansion. They need new facilities. They need new spaces. They need repairs. They need a lot of things done. Each one of those. I'll give an example. We need space to add a smaller gymnasium so that we can keep the gymnastics equipment going and allow the gyms to be used, and we don't have to take a half a day and close everything to move everything out and move everything in every time a program changes. And so that would allow us to have those things available for more kids, for more activities, for more things that they can do. There's a demand for splash pads. We have one, Kill Devil Hills has one, but we don't have one anywhere else in the county. And I'll tell you just from my own experience with my grandkids in other places that when we're there and the weather's warm, that's where they want to be. That's somewhere where we take them just about every time that they go. And if you've been by Kill Devil Hills when it's warm, theirs is highly used. And so splash pads are something that, again, our studies showed us that we needed to do, and we have places that we could do that. I'll just use it down on Hatteras Island at the Rodanthe access site. There's space there that at one time we considered putting a splash pad there. We didn't do it at that time for budgetary reasons, but that was in the program when we looked at it one time. Our playgrounds throughout the county need repair, replacement, upgrades. They need to get some ADA capacity. There's lots of things we could do to make them better. Right now, they're all compliant, so we don't have compliance issue. They're not dangerous, but they're also not up to date, and they're also not what they could be, and they also don't provide the number of activities that they could if an update would allow us to do. And again, all of these things are things that were put in the survey and that the people had asked for. We just dealt with pickleball, and so that's really not on the list anymore.
Well, we need something for Hatteras.
But we need something for Hatteras, that's correct. And then, we've got some lighting and security issues where we need some cameras, some more lights, some more things in and around our facilities. This recommends that we, land bank some money to start growing a fund for future things as the county grows, as needs change. During the 20 years that we would finance this plan, other things are likely to come up that people want or people need, and if we're saving for that and have the ability to do that, then we can do that out of this fund. Over at the old swimming hole, is a nice location, not particularly nice for swimming. It's dangerous for swimming, and so we've closed the swimming part of it. But we do have a gazebo there. We do have bathrooms there. And with some work and some repairs, we could make that a nice location. Beautiful sunsets out there. If you could go out there and sit and have a picnic lunch or picnic dinner and enjoy that site, it's a nice place to do that thing, and it needs some work there and some planning there as well. And then there's been requests from multiple sources for outdoor space, greenways and trails and ways for people to get outside and move around. I know Commissioner Balance has really been pushing for those kind of things, but I think just to verify her pushes that our community survey requested those things too as one of our priorities too. And so those things all come with cost, and they're all funded by this. But again, this is a way that if we were going to do those things and do those kinds of rec programs, and there's a number of more, I commend anybody that really wants to know in detail to pull that report out. It's on our website, I think, and you can go there and look at it and see what we're doing and what the community has said that they wanted to do and what we needed. And if we're going to do that, then this quarter-cent sales tax is a cheap, easy, sort of burden-free way to accomplish it, and it doesn't pile onto our ad valorem tax, and it doesn't pile onto our citizens and tax them even higher on the properties whose values are escalating. So it's a good way to do it with the least amount of impact to the taxpayers and then the most participation from the visitors who would use some of this stuff as well.
I think you covered that well, Bobby. It is, I believe the legacy projects are also included in this that we could accomplish. That's expanding the indoor at Westcott, also the indoor expansion on the northern beaches and the expansion of the Feddersen Center. So they're all included in this top priorities if we can get this quarter-cent sales tax approved.
Yeah, I mean, $40 million of the total. Put turf on our fields, land bank some money, and add indoor facilities at Westcott, in the North Beach area. Per the study, North Beach is defined as Nags Head to Duck, and Fessenden Center.
Yep.
They're demanding access to indoor courts.
There's also improvements at Westcott Park here on the front
And
line as well.
if I didn't say Westcott, I meant to. I'm sorry.
He did.
Yeah. And those indoor facilities, I continue, like most of us, to hear an enormous cry for give us more, we need more. And again, the access to the fields with turf gives us 12-month a year, 24/7 kind of access. So I guess my point is, these are the big ideas and the big needs. We can solve them with this. So I hope folks will consider that such a vast majority will be covered by tourist dollars and the 0.25% sales tax, and a very, very small burden, as in, how much was it again, Matt? $1, just something a month?
$14 a year.
$14 a year. Again, it seems like a compelling case to do this for the community and for our county, so I'm done.
Well, thank you.
One thing I'd like to point out too, before we get too far down the road on the turf on the fields, is we're going to have a long conversation about the safety concerns that the turf brings, because statistically proven, it's somewhere, I mean, I want to say it was in the 32%, I forget the exact number, but it was a high rate of injury on turf-related fields versus natural grass. So that's something, I think when we get to that point, we'll have to sit down and have a long conversation about, because you know, and you're talking about mostly collegiate, professional facilities.
Well, that's where I was going.
Yeah.
How many high school fields are artificial turf, and what are those statistics for high school fields?
Yeah, and that's what I'm saying. We'll have to look at that when we get to that point. I just want to make sure that we bring that up now.
I'd say less than that, because we're not talking about high school athletics either. We're talking about youth athletics at a much lower level of skill, a much lower level of contact, a much lighter impacts, significantly less impact. So, again, our largest outdoor sport is soccer.
Soccer, yeah.
Our highest impact sport is youth football, and that's small. And then those fields can be used for baseball, lacrosse, whatever other outdoor activity that you can think of that, you know, where you don't have those injury things that you're talking about.
Well, and a lot of the injuries caused on turf fields too are from non-contact, though.
And I'll tell you that there are rec programs throughout the state. I mean, I may have mentioned it before. I was at the zoo in Asheboro a few months ago with my granddaughter, and we went into Asheboro to eat, and on the way in, there's this beautiful, nice facility that has 5 baseball fields and a couple of soccer fields, and it's lit up, and it's got an archway that names it, and, you know, dugouts and everything you would want, and the whole complex is artificial turf. And so it is where they're going. Strides have been made, and again, it's something that rec departments, if you ask Spencer, are going to, even having looked at the statistics you're talking about, it is sort of the wave, and I think that you would find that the statistics that you're talking about are really for the high, as you said, for the
higher level leagues.
High-level leagues. Yeah. So anyway, that's something we can talk about if we
when
get
there.
far.
Yeah.
And,
we get down that road. I mean, the vice chairman's already mentioned that at an earlier meeting. He was concerned about the. He brought that to our attention about the fact that the higher injury rate. So, yeah, but we can certainly discuss that when it gets to that point.
I would Matt has put some significant work in the CIP and trying to figure out how we would fund this and seeing if there was any other way to do it or any other way to make it work. And after hours and hours of trying to juggle and do the things that we do, there wasn't another way. I don't know if you want to add anything to that, Matt, but just.
Yeah, no, I think not without putting this at a priority above other things in the plan. So.
I mean, this could really be a home run for us if we could get this referendum passed. I mean, we get that passed, and we can fund every single thing that these consultants have brought to our attention and really bring our facilities up to the 21st century, because our stuff is really outdated and really needs some improvements. And, you know, for that little bit of money per household, that's just a no-brainer.
I got a few questions, because I'm 50-50 on this deal. Obviously, it's a tax increase, and that's the bottom 50 of it. But the $56.9 million, that estimated loan amount to fix all the stuff that advisory council wants, correct? For now. How long will it take for that $6 million per year annually to pay for that rec project?
20 years.
20 years.
20 years, that $6 million will pay?
Okay. And leave some money left over to cover operations.
Okay, just because if we're doing a sales tax increase, which I agree with 100%, and the reason why is because if we're going to raise taxes, it's better off to do it that way, because it takes less of a burden on locals, and like you said, 70% estimated will be paid by tourism dollars. The issue is we got a lot of other situations in the county with hiring problems, staffing issues. Number one, because of cost of housing and everything else, it's hard to staff a lot of places. Heavy equipment operators at the landfill. There's a lot of other issues that are going to require extra spending in the future. So I'd like to see at some point maybe this money get a little more spread out. Obviously pay for the rec facilities now, that's the major project, but at some point I'd like to see it spread out, maybe where we could pay people a little more. I mean, you take $6 million and divide it by 800 employees, that's a $7,500 average increase per employee.
What does it have to do with the price of eggs?
So, well, I'd like to see the money potentially spread out at some point to maybe pay people a little more and take less of a burden on the ad valorem tax and the property tax, which generally pays for all of that.
We
currently.
diverted the $6 million, then we would have nothing to fund the loan, and there would be no Parks and Rec expansion.
And
Or
if
twen-
if I'm not mistaken, under this referendum, it can only be used for that purpose.
That's what I was gonna
If you
ask.
defer it, you're in violation of law.
Right.
No?
That's not.
No, that's not correct. You can use it.
The
whenever.
referendum doesn't allow you to put, the statute says you can't, the question in the referendum is, do you support the quarter-cent sales tax, period? You can't put in there for Parks and Rec or for anything else. And so, once you get it, it goes into your account. Once you borrow the money, then you commit it to that funding source, because that's how you're gonna get the borrowing approval. You gotta have a revenue source to do it. So, once you committed it, you gotta have revenue to pay the debt service on it. But if you paid it off early, if something happened, then you do have the authority to use it for other purposes down the road, so.
Yeah,
Would it
instead of
take
a
any of
splash pad, how about a man driving a tractor?
Would it have any effect on our current, what we currently budget for Parks and Rec? Could we decrease some of,
It'll increase that.
I know, well, I got to think about how I'm trying to explain this. So you're saying that the 6 million will be for operating costs,
No. No.
maintenance?
No, so.
No.
Debt service.
Wait,
Additional.
debt service?
So you're gonna borrow $56 million, and you're gonna make all the improvements that were set forth in the study.
Right.
And then you're gonna have to hire staff, and you're gonna have to pay the added maintenance costs that added facilities come with. And so that money would
Okay.
fund all of that.
I see what you're saying.
Yeah.
I'm sorry, I was thinking that was, okay, if we're saving it there, we can,
Yeah.
but gotcha. We're adding to
So we're adding to, we're not taking from.
completely, gotcha.
Back to Commissioner Creef. I'm not sure he had finished his comments.
Well, I mean, that's the deal. I mean, 57 million for one department when we've got numerous departments we could potentially use this money on. Maybe we spread it out a little bit, just a little bit, because we do have staffing issues at numerous other departments in the county. And like I've heard a lot of things extra additional, like splash pads and certain things that we may not necessarily need. We do need heavy equipment operators in public works. We do need a lot of the other things that are potentially, I mean, if we're going to be advocates for this tax increase, I just want to make sure that the money is spent as wisely as possible. But I am in favor of the referendum. I think that it's the perfect opportunity to generate more income, to be less of a burden on our ad valorem and our local taxpayers. I just would like to see the money used potentially in other directions. And then after the 20 years is paid off, we're still going to be generating that revenue, whatever it is, maybe it's $7-8 million a year by then because of inflation. We'll have opportunities at some point, probably a commissioner's long after me, but to use the money in different directions, correct?
Correct. So that is correct. So what will happen is if the referendum passed, then you all would have to have some meetings and a capital improvement meeting and talk about your capital improvement needs, and you would plug this money into the capital improvement plan, and then you would dedicate it to the priorities that you have. What we're saying right now is the idea is that this money would be used to fund this Parks and Rec thing. If the numbers change and there's added money or different money, then maybe you do different things, but that's what you're saying. But you will have an opportunity before you start construction, before you sign any contracts, before you do anything, to make sure you're satisfied that it's going to the right priorities, not only the priorities in the plan, but the priorities period. So this won't be the last discussion. This is just if we're in favor of moving this way, and if we're in favor of funding that Parks and Recreation plan, then we got to find a way to do it, and this is the only way that we could come up with, unless you're going to not do public works or not do EMS stations or not do some of the other things that we're committed to. So,
If I can help.
Oh, go ahead. I was going to make,
If I can help my fellow commissioner, and I think what you bring up, Commissioner Creef, is extremely important about staffing issues and problems and pay. We have a budget. We'll be talking about a budget coming up soon. This board stepped up to the plate in recent years. We've had 2 major salary studies, and help me out with the years, but just within the last 6 years, we've put over $8 million in the budget for increased salaries. Instead of looking at COLAs every other year or every 2 or 3 years, we're now doing COLAs every year. We also did not do away with merit and bonuses. So later in this meeting, item 10, we're also going to discuss some staffing issues at Public Works that I'm sure this group will support. So I'm hoping I'm helping you with the fact that I hear you loud and clear, and you make a very clear point, and I'm fully in agreement with what you're saying, but this board has stepped up to the plate, and I think we will continue to step up to the plate with respect to trying to take care of our funding responsibilities for staff. So
I'll make a motion to take the Capital Improvement Planning Committee's recommendation to include a 1/4 cent sales tax referendum on the November general ballot to finance the Parks and Rec recommendations.
Okay, there's a motion. There's a motion on the floor by Commissioner Balance. It's been seconded by Commissioner Bateman. The floor is open for further discussion. Hearing.
I'll go.
Go ahead. Go ahead.
So let's look at this thing. We've been talking about Thrive this morning. We're talking about the Polar Plunge. Let's look at this thing as being an investment for the lifestyle of the people of the Outer Banks. That's the big thing. And this is a change, has the ability to give us better places for older adults, younger adults, intermediate folks to be able to get out and get a healthier lifestyle. But the big one is the greatest asset we have on the Outer Banks is our children.
Yep.
From the time they're 6 years old, 5 years old, in little flag football, whatever, until they become 18 and go off to college. The greatest asset we have is those kids. We need to keep them in ballet. We need to keep them in football. We need to keep them in gymnastics. Everything that we can throw out there for them, splash pads. Because, and I've sold it, and Justin's getting tired of me saying this, we don't want them in Dare Challenge. We don't want them in recovery court. And Courtney Gallup and David Twyford damn sure don't want them at the funeral home.
Right.
Thank you, Irv.
So let's get our butt to work and go out there and sell this to the public. Do it in a nice way. Tell them I can afford $14 a year. I don't know anybody in Dare County that can't afford $14 a year to help save a life, because that's what we're doing with this. I think this is the most important thing we've done this year.
Couldn't agree more, Irvin.
And one last thing to what he just said. Back in 2007 and 8, when we were in the budget crunch, one of the things we looked at, Parks and Rec is a discretionary spending. You're not mandated to have that. And so you start looking at all your discretionary spending and say, okay, where do we cut? One thing we didn't cut was Parks and Rec. And the reason we didn't cut it is because the sheriff came before us, made an impassioned plea not to do it. He said for every kid that we exclude from Parks and Rec is another kid that's out and having to deal with him and his people, and that Parks and Rec is a godsend for our youth in terms of their interaction and the need for law enforcement to be involved in putting people in his jail. So we again, along the same lines that Irvin was just talking about, is, this is something to keep people occupied. It becomes an after-school program. It helps our parents. It does a lot of things in the community besides just go have fun.
Absolutely. And I'll elaborate a little bit more on it. I see it firsthand because I referee recreation basketball. And our facility in Kill Devil Hills, we've got over 700 kids, and that doesn't include adults that are playing basketball this season. We're always hearing from the indoor pickleball people where we have to shut it down because we have gymnastics for our young kids. So we have to shut that down so they can't play. And so this will allow us to expand those facilities to offer more activities for every age group out there. My kids are grown. I got a 49-year-old son and a 48-year-old son. I don't have kids in the system now, but I can sure afford $14 a year to help somebody else's kid experience a good time and keep them off the street and enjoy the facilities that we have here in Dare County. So
Last night when we were leaving the meeting, how many guys were out there
That's-
playing pickup ball in the?
That's
Thank
right.
you, Mary Ellen.
That's right.
That was the one night a week.
Yeah, only one night a
that
week.
Fessenden allowed
Right.
that basketball access. And
Right.
I thought, doggone, they could probably use 2 or 3 nights.
Right, that's exactly
Yeah,
right.
Good point.
And
Mary.
summertime's fine, but this time of year,
Oh.
one night a week, look at what we could do to expand these facilities and everything for folks. So I'll be working extremely hard trying to convince my constituents that this really is a no-brainer. And somehow, some way, we got to figure out for families to spend $14 a year to help us make this happen.
Yeah, because I could actually expand on that a little bit more too. It's not only just for the kids, but also our younger adults and also our senior citizens to
Right.
use these facilities as well. And they have programs they would like to see and have get done. So this is an all-around community effort for everybody, not just the kids, but senior citizens, the average young adults. So it's something that can help improve the lifestyle of everybody on the Outer Banks.
Yes.
And so I'm totally for this. And like we said, with this revenue source, we can start immediately
Yes.
on these things instead of having to wait 10, 20, 30 years from now. So I'm all for it, and I will be doing my best to advocate for it.
Thank you, Vice Chairman. Anyone else? All right, with that said, we're going to take a vote. All those in favor of this motion, please signify by saying aye.
Aye.
Aye. Pose like sign. Motion carries unanimous. Thank you, gentlemen.
Thank you.
Lady.
This takes us to the presentation for our June 30th, 2025 Annual Comprehensive Financial Report and Audit. And Matt, I'll turn that over to you.
Okay, so this is going to be a joint presentation with our engagement partner, Dan Moreau, and myself, and hopefully Dan is on. He's there? He's there. Okay, well, hopefully we're going to get Dan on, and Dan will start us off. This is the cover slide as he gets set up. This has the link to the ACFR. There's hard copies in the back, but we'd encourage everybody to go out and find it on the website. It's a public document. Okay.
Good morning. Can you hear me?
We can hear you now.
Okay, great. I'll just dive right in. So as Matt was saying, I'm your audit partner, and just want to thank you for allowing me to remote in. So again, just we were formerly Potter and Company. We have merged as of last July, but it's still the same team of auditors. Bob Taylor's still your consulting partner, and then I'm your engagement partner. And so just we'll speak just for a second. The merger, we are now DMJPS. We have expanded our footprint to 10 locations statewide. And so the purpose of that was to grow the resources and the support that our clients can lean on and depend on. And then and then otherwise it's just a name change. So but as Matt said, we'll just very briefly run through the major sections of your annual comprehensive financial report, your audit, and then I will discuss exactly what the audit determined and sort of review that. And then Matt will follow up with some specific financial information that you as commissioners should know. So if you see the major sections slide here, so letter of transmittal, that's the just the introduction letter of, and it does discuss just financial highlights. And then you have your audit report. That's of course from us, your external auditors. And that, just real quickly, that's a clean audit. That's an unmodified audit. So those were your financial statements are presented fairly as of June 30, 2025. Your management's discussion analysis, page 17, that's your narrative form, and this is your operations. So this gives you comparative information, and it's a nice presentation of the accounting policies, procedures, your fund accounting, and it does discuss even operational results, and just really just a brief summary of everything that the financials in because there's over 200 pages of your audited financial statements. So the next section, your basic financial statements, that starts on page 29. And again, Matt's going to cover some key information. So, and then your footnotes, that does describe the accounting policies and your specific account balance details. There were no major changes this year in accounting principles. We did have a new principle, but it did not materially affect the audited financial statements. Then you have all your combining and individual funds, specific fund financial statements and schedules on page 113. You do have, the county has 37 individual funds, and those are broken down between your governmental, enterprise, internal service, and fiduciary fund types. And then the statistical section on page 185, that's the 10-year comparative data. And this is really good information. This is financial trends, revenues, debt capacity, your principal property tax values, principal employers, and other demographic and economic information. And then your compliance section, which is again where we have reports, and I'll cover those in just a second, but we're required to do additional testing on your federal and state financial awards each year. So your audit results, again, a clean audit opinion. But as your external auditors for your financial statement audit, we're required to do what's referred to as a risk-based audit. In fact, we design those risk-based, or we evaluate those risk-based specifically for Dare County as a governmental unit, as your location, the type of revenues and expenditures that you specifically incur. And then we adapt our testing and our procedures based on your specific risk that we identify. And then another step is we must obtain an understanding of your internal controls and the policies and procedures that you have in place, and then we adapt our audit testing based on the controls that you have. And that's sort of just a very quick summary of what we do in your financial statement audit, because as Matt will speak to in just a second, we presented a more in-depth report to your audit committee. But the last, just real quickly, we do have you're required to have a federal single audit, which is referred to as uniform guidance. And then also, because of the state awards that you received, you had a state single audit. And then we also do a yellow book audit. And so similar reporting, no findings, no material discrepancies. These both reports, the federal major award compliance and the state audit, single audit, were both clean, unmodified opinions. So the staff, the accounting department, the Department of Social Services, everything that we tested and pulled and support that we needed to do the testing, they did a really good job. So just want to say, again, just if there are any questions, if not, I will sort of transition back to Matt.
Any questions for Dan before I? Okay. Thanks, Dan. All right, so as we just mentioned, the audit committee met at the end of January and with Dan, and really some of the focuses of that meeting.
Matt, I want to apologize that there's such a small audience for clearly the most exciting part of today's meeting. So on behalf of everybody that left, they're going to miss it. Please continue.
It's a set. This is what we are. The life of an accountant right here. I'll try to keep this as exciting as I can, but it's all good exciting. So focus of that meeting included internal controls, and what Dan just went through is the series of types of audits that we have. So your financial statement audit is based on a level of materiality, but when you get federal and state funds, the yellow book and some of those things he referenced were really compliance audits with a much lower level of materiality. So if you go through those audits and there's no findings, no question cost, that is actually very impressive. As an accountant, I can tell you it's an exciting thing. So, and it really just reflects well on our finance department and our team. So things that we have in place at the county that others might not have include an internal audit process, and that's what this chart is in this slide. So we're not just looking at federal spending and things that are in that 220-page document, but we're actually auditing all of our cash receipts and handling. And so you can see that Carter did 37 on-site audits last year. Everything from P cards to...
I agree, Matt. Let's have a call out for Carter Nam because he's done a fine job. I'm being deadly serious here. This is excellent results. So
no, it is. And honestly, we should, if we had more time, I'd shout out the whole team individually because it's really impressive. So key takeaways beyond the fact that we did a great job and that we have robust internal controls and we're looking at things beyond what's in that report is that, as Dan said, we have an unmodified audit opinion. We had no findings. And this last bullet point is just to highlight again that the county has been awarded the Certificate of Achievement for Excellence in Financial Reporting, and this is for our 2024 filing, and that's the 34th consecutive year. So just showing that we take a lot of pride in this process. Now, the one thing that we've had in the past, and we have again, is what is referred to as an FPIC, a Financial Performance Indicator of Concern. And this comes from the State Treasurer and the LGC Commission, and it's a series of tests, mathematical tests, just to evaluate the health of the entity. And there is one that really isn't applicable to us in that it's an oversimplified calculation, but our capital asset condition ratio, which should be at 0.50 or higher, is at 0.48, which is up from 0.45 last year. What does that mean? It means that there's a calculation that looks at how much money you spend on your water department in the system, and they expect that you are going to have investment that keeps your capital asset ratio above half, meaning it's less than half fully depreciated. Again, what does that mean? So it's a simplistic calculation, and we are not a simplistic county. We provide water to 38,000 people sometimes, and 350,000 people at other times. So we're not taxing our water system in a consistent way. It's secular based on that consumption rate. And this math is being done as though it's a equitable demand throughout the year. So in the past, and we'll do this again this year, it's in the consent agenda, we send a letter signed by the board, and attached to that letter is a report from our financial consultant that helps us set our water rates that basically just explains why this isn't applicable, and that has been acceptable.
Let me put this in more layman's terms. This FPIC that he's talking about is a measure that the LGC or the treasurer uses, and it's a useful tool for places that aren't investing in their assets. And if you have some communities that are troubled, that have a water plant or a administrative building or some other asset that they just don't take care of, then you get under that ratio and they're saying, hey guys, you've got a problem here. You got a building that you haven't taken care of, you haven't done what you're supposed to do, and you're gonna have to come up with some big money here in the future to deal with that, and you need to be planning for that. And it's trying to help those people that aren't planning and that aren't doing the things that they're supposed to be doing with their assets be aware they got a problem coming down the road so that they can deal with it, so they don't get in the LGC's troubled community portfolio. We're not even close to that, and if you go into our water plant, it's immaculate. It looks brand new, it's clean, it's nice, it's taken care of, we take care of it. And so none of that applies. The problem is it's older, it's in great shape, and it's depreciated, and we haven't put huge amounts of money in it because we haven't had to, because we've done it in smaller increments over time. And so that ratio is such a simple formula, it doesn't take into account that. And so for entities like ours that have assets that are well taken care of, it gives a misrepresentation of the need. And that letter you're going to sign says that in essentially those words. And we've sent that letter in for a number of years, and they get it. And it's our ratings companies don't even look at it. They don't think it's even an issue. And so we bring it up because it is a letter that you have to sign, and it is something that you need to know, but you also need to know that it isn't pointing out a problem that it's designed to, because it doesn't take into account enough of the factors to do that in a more sophisticated operation like we have. Is that fairly said?
That's
so
great.
That's what we're talking about.
Okay, back to good news. This is just a summary to show you that we've done all of the things that we need to do by their deadlines. So that includes filing the ACFR, filing with the GFOA. Because we have a municipal debt, have continuing disclosure requirements that we file. This is information for people that are evaluating, either because they hold Dare County debt or they might be purchasing it in the future. And then that information is then, we provide evidence of that back to the LGC, and then they do their review. And so they conducted their review and did not have any comments, and we received that notification on January 6th. So as of January 27th, only 14 of the 100 counties had submitted. So we are, you good?
That's what I was going to say.
Oh, okay.
We'd say, well, we met our deadlines, and y'all are thinking, well, of course we met our deadlines. But that is a big deal, because a lot of counties, as 14 out of 100, have met the deadline. Part of that is money. Part of that is not being aware of what you got to do. Part of that is not being able to find people to do their accounting. But we managed to make all that work, and so that's a tribute to Matt and his team to be in the 14, not in the other 86.
Yeah. So.
I was saving my kudos for later, but you're absolutely right.
We'll take them throughout the presentation. That's
Feel free to add.
So this slide is just, so it's 220 pages that you have to read. My advice is don't read it like a book. It's more like an encyclopedia. What this slide is showing you is that there's multiple presentation formats in the ACFR. And so when we manage the budget of the county, we're doing that in what they call the modified accrual statement, which is a cash basis more or less, which means we have to have the money in the bank to make payroll. And when we approve budget amendments, we're thinking about it that way. Now, there's also what's referred to as the government-wide statements, and those are the full accrual-based statements. That's where you get into that depreciation idea that we just talked about, the FPIC for. That's more for like rating agencies. So the majority of what you're going to be focused on as commissioners is probably going to be those cash basis statements, but they're mixed in there. And so if you're looking at something and it looks off, it may be because it's in one of those other presentations.
Thank you, Matt. This slide, this explanation is in response to some dialogue Matt and I have had in trying to help explain and break down this very, very large document to make it a bit more understandable on how to read it. So thank you for that, Matt.
Sure. So this is actually on the full accrual. So this is our government-wide financial statement. And this is just highlighting, and it's, I don't know, if you have it in front of you, you can probably see, but this reads left to right and then top to bottom. But the county's net position is $258,671,086. And that's a $21.7 million increase from last year. This again is on an accrual basis. It's not money you have in the bank, but it's showing the health of the county. And the split of that increase is 89% governmental and 11% business type. So you can think of that as growth in the water department as the business type. 54% of that growth was from our investment earnings. So because we've been able to earn money by investing our money, 11.8 million roughly of that growth has come from that investment. So as interest rates go down, our cost of borrowing goes down, but our ability to generate money on our money will also go down proportionally. So this is, if you're Moody's or S&P, this is how you're looking and thinking about the county. Now, some of this, and this is actually a good slide to just show you this historic growth in our net position. So you can see we had some change to our OPEB and pension structure where we created irrevocable trust and started building a portfolio to fund those expenses, which took them out of our operating budget. So there's a lot of things that we've done over time to make the county fiscally healthy. But there's also kind of a trick of accounting that is happening. And in the state of North Carolina, if we build, we'll use the early college because we're doing that in the current fiscal year. The asset of the early college will not be in our financial statements, but the debt of the early college will be in our financial statement. So that 21 million next year immediately goes away, because we just took $23 to $25 million of a liability onto our books, and we didn't get to keep that asset. So you can see that this chart is just showing that we borrowed a lot of money for the schools, and we've been paying that down over time, and that's made us stronger from a net position standpoint, but that's going to shift as we start to borrow again for schools, and that's sort of a trick of the accounting. Now, but that's not really the entirety of it, but it is a material portion of it. Those changes that we made to the post-retirement benefit model are substantial, and then we've also done things and it came up earlier in this meeting, to address the growth in our health plan model. And then there's just the prudent financial performance and management that we've had over the years. So it's all good news, but it's just to say there is, like everything in asterisk, and that has, for us, is the accounting for school debt. So this slide is just to summarize that we have our we'll call it our reserves. It's not really called that, but we have the money that we have saved over time. And when we set the budget, we plan to spend some of that in the next year. That's that spending policy that you voted a change for in the last year. And that's a function that we'll be revisiting again when we're setting the budget for next year. So throughout the course of the year, we had voted to spend $9.9 million of that reserve. Now, we ultimately only spent 1.5 of that, and that's because we were positive variance, or we were under budget and expense by 9.9 million. Our revenues were pretty close. And what was in that 9.9 that we were able to fund? 3.7 million for the EMS land purchases, 415,000 for this school lunch program, and another 410,000 of expenditures that we were able to get done in this fiscal year to take some pressure off of next year's budget. So takeaway, plan to spend 9.9, really only spent $1.5 million, and so that's a very positive outcome. This next slide is just showing you that we were under budget a little bit by revenue, and these are the factors of that. So our property tax growth was less than the 1.85% that we had budgeted. Occupancy tax was down 4.24%, and we had a 3% increase in the budget. And then local sales tax was down a little bit. So our EMS fees continue, as we saw Jenny up here earlier, come in above budget. This slide is just showing you the expenses, the 9.9 million that we were under budget. Really, this is the vacancy savings. This is the fact that we have these open positions. There are some other things like the timing of grant funds that impacts this, and things like open purchase orders. But you can look at this slide, and this is really just highlighting some of our larger departments that are under budget. So,
Matt, the biggest number on that page is $6 million, and it's called Other.
mm-hmm. Yeah, so that's all other departments. So the threshold used for this slide is if you were a department that was $250,000 under budget, you made the highlight reel of this slide. And if you were a department that was under budget, or we'll just say at budget, by an amount lower than $250,000, you're in the all others category.
So if they were under budget on average $100,000 each, that's 60 departments.
Yeah, so there's not 60 departments.
Right.
So some of them are really close to that 250,000.
There you go. Okay.
Yeah. So we have, Dan mentioned there's 37 funds. We have what's called the general fund. We talk about the general fund. Our operating budget we refer to as the general fund, but just for fun, for the ACFR, there are a number of funds that are consolidated into a consolidated general fund. And that's what this slide is just showing, is that the consolidated general fund changed by $3.4 million. The general fund that we think of, the operating budget, that $1.5 million that we spent, that's that top number. But these are some of the other funds. The Community Housing Development Fund, the board had approved to take $2 million out of for deferred maintenance in the fiscal year, but it's really those two numbers that make up the total change in our consolidated general fund. So, okay, you made it to the last slide.
Yes.
Okay.
And we're all still awake.
You're doing great. This is the water department. We have, everyone take a sip of coffee. Is that all right, we have revenue bonds, and so revenue bonds have compliance requirements, and specifically there's calculations to show that you are fiscally have the capacity to carry the bonds. And so our water revenue bond coverage is 7.68 times. The higher the number, the better. the required coverage is 1.5. And so that just reflects that net position of $64,105,000, which went up $2.2 million this year. This is, again, on an accrual basis. You'll recall that we did spend almost $16 million on the water main project, and so that's reflected in these numbers. So that is your race through 220 pages of the ACFR and the audit process. Is there any questions?
Thank you, Matt. Anybody have any questions of Matt?
So I guess we were roughly 2% down on the water revenue, because it's showing 3% revenue, but a 5% increase rate. So we just used less water, I guess.
Exactly, yeah. And that's the trend in the model, because as people install higher efficient toilets and appliances, the actual demand shrinks. But yeah, the water rates in the last year went up by 5.
So the county manager is comfortable with the 7.7 times water bond coverage compared to the 1.5 required? Sorry, that's a little dig at Bobby. He's taking it with good humor.
Yes. All in all, as you saw, it's a really good report, and our financial condition is really strong. You said save the kudos to the end. Matt's been here a couple of months, and so the first half of the year Dave did the work, and the second half of the year Matt's been doing the work, and he's come in and drank information from a fire hose and absorbed it and used it and has hit the ground running, and we haven't missed a beat, and I can't say enough good things for all the good work he's done to keep it going, Also commend his staff. He's talked to you a little bit about, and not just his staff, all of our staff. I've been here, I'm going on 18 years. We've had close to 400 staff meetings in that time. And I don't think, Dorothy, you correct me, but I don't think there's been a staff meeting yet that we've had that we haven't preached budget management, take care of your budget, look to the future, plan, do all those things. And our staff, taking that task to heed, have done that and allowed us to come in under budget. You hear all the time about the federal government. They get to the end of the year, you got to spend all your budget or you won't get it next year. We don't do that. We talk about that every year. You don't spend it just because you have it. You spend it because you need it, and if you don't need it, don't spend it, and we'll use it next year for something else that we need. And they've done that, and our budgets have come under because we've done that and been very meticulous about that. Dustin's done a great job in our procurement, trying to make sure we get the best prices for things. And so all of these things working together with the whole team make these kind of reports possible, and I'm real proud of the work they do. So.
Yeah, I mean, $10 million under budget and expenses from across. I mean, did we have a single department go over?
No, we don't really let them.
I know, but I'm saying, did we have one that was even close? I mean, it looks like to me $6 million less in expenses. I mean, you saved $10 million right there in expense budget. So I want to give a congratulations to you, Matt, Dustin, Bobby. Excellent job on keeping our spending down. $10 million, that's a big deal. Not to mention $11 million in revenue from the investment.
And just in that, we monitor that spending monthly.
Oh, I know.
We have graphs, and if you get in the red, you get a phone call, and if you get a phone call, you got to figure out. Okay,
they must be good phone calls.
I went over in this line, I bought too many of this, I got to buy fewer of these to balance this thing out, and we don't let them get in the red at the end of the year. So.
Well, $10 million under is really good.
Thanks, Matt. Well done.
All right. County Manager, we're going to take a 5-minute break. Meeting back to order. Turn it over to the County Manager.
Mr. Chairman, item 10 on the agenda, we need to talk to you again about some staffing issues and take some actions to try to resolve some problems. And it's interesting, fits right into the comments that you made earlier. Our C&D, our rubble transfer, our recycling department have had staffing issues there for some time. We have 20 positions that require CDL license, and 9 of those positions are vacant. So almost half of the positions that we need to do that work are vacant. We've got supervisors out there running equipment and doing all kinds of stuff. We've got 2 resign. We've had a couple that moved to go into the private sector because they got more money. We've got a few that have gone to other towns because they got more money. And some have transferred internally in the county to different jobs again to make more money. To make matters worse, we're not getting applications to fill those positions. And so we're at a place where we're at a precipice. If somebody gets sick, somebody gets in a wreck, something happens, then we're going to be in a mess in those departments. And so we got to do something about it. You recall back in '24, we had a similar problem in sanitation. And in that meeting, we went through some of the same problems. And at that time, we increased their hiring rate. And today, I'm glad to say, 100% employed in our sanitation department. So we solved that problem, and we solved the problem of people moving and doing those things. And when we do have openings, we get applications. And so we had a solution that worked, which leads us to where we are. We need to do something with salaries in those departments, and we've done some calculations and we've done some work on that. The cost for us to do that is grossly about $260,000, almost $261,000. That's across multiple departments to increase an equipment operator's salary. In the landfill, you got to sort of give the guy in the water department the same increase to keep your salary structure on parity. Equipment operator is an equipment operator, and he doesn't make different wages because he's got a different boss. And so you keep those things parity, and when you go across all those funds, it's a $260,895 cost. When you break that out, about $158,000 of that would be paid for out of the water fund and the sanitation fund, and the other 109 would be paid for out of the general fund, because that's how the departments are labeled. So the general fund would cover the 109, and then the water rate and the sanitation rate would cover the other $158,000. For the rest of the current year, if you chose to change the salaries as we're providing, then we can cover that out of the lapsed salaries. We've got enough money because of all the vacancies that we can pay that to whoever we get. If we could fill them all tomorrow, we would have enough money to cover it for the rest of the year. But next year, you'd have to do something in the general fund to cover that $109,000. So that would become something that we'd have to do to solve that. In the water department and then the sanitation, Hatteras does our rate studies and our rate analysis to keep our rates right to afford to operate and also to afford our capital needs. So they do their water models, and they would run something, and we would have to do something or nothing. I'm not sure yet where that would come out to cover that 158 in between those 2 departments. And so that's how it would break down come budget time. And so what we're asking is that you allow us we've got a schedule of rates, and it's roughly about $10,000 a position. Is that right, Matt?
Closer to 8.
Closer to $8,000 a position to increase those salaries. It breaks out to not exactly that and some change. I don't want somebody to say, you said I was going to get 8 and they get 8.2 or something like that. But it's around $8,000 a position for roughly 20 positions. And so that's where we are. And before we did that, we needed your authority to do it. We kind of came to the conclusion, if we're going to provide those services and we don't have a choice about the sanitation and stuff, then we've got to do it. We looked a few years ago at what would it happen if we privatized that so we didn't keep having these problems. Doesn't solve our problem. The cost to privatize is greater than what we do it for already. We found that out when we got those bids back then. They have the same staffing issues, and their problems come, we can't do anything about it. So when they tell me they didn't have somebody show up for drive a truck, the truck just doesn't come, and I can't send somebody out and do it with another truck or another driver or whatever I got to do to solve the problem. So that really wasn't a good alternative. Plus, if you privatize you get rid of all your assets. And so all of a sudden now they've got you by the barrel and they charge you whatever they want and cost you multiple millions of dollars to get back in the business to compete with them and keep their prices honest. So I say all that to say we don't have many choices except to do what we're suggesting and hope that it works as well here as it did in our sanitation department when we did it about a year ago.
Bobby, I don't have any problem with this, but another aspect of this that it doesn't appear that we've addressed, can we get drivers now that those replacements that have CDL? Because if you recall, several years back, we had problems hiring people that even had CDLs, so we enticed them to come on board and we would get them the training that they needed. Are we still in that position out here in the marketplace where we're looking for people that, even if they don't have a CDL, that we could hire and put them through that training?
I think the answer is yes. I think the other answer is we require them to have a CDL because they have to drive the trucks, and they're also our backups for when our other drivers are out and all those kind of things. And so that's how our department is run, to minimize the manpower that we need across all those departments. In some of the departments, if all you're going to do is drive a bulldozer on the landfill and push dirt, then you don't need a CDL. So in theory, we could do that, but then you don't have anybody with a CDL who can do the other things, and we multitask those people so that we don't have a bulldozer driver and a CDL truck driver. He can do both and do it all. And so we talked about, eliminating the CDL requirement. What we want to do is get the salaries competitive, and assuming that we do, if that works as it did in sanitation, because we started getting applications when we got the salaries right, then we don't have to make those other changes. If this doesn't work, we're still going to be in peril, and at that point, we're going to have to start looking at doing some of those things. Do we just say, hey, we got to put the top cover on the landfill, whether you can do the other job or not doesn't matter, so we're going to hire you without a CDL if you can drive a bulldozer. We'd like not to do that, because that's going to then put pressure on us to get drivers to make up the slack that we are now making up with those guys that operate equipment. So we're trying to work the balance to keep the manpower as low. This is the first step, and if this works, then we don't have to go to the other steps.
I mean, even if you approached COA when they do a CDL class, see if you just put a flyer out, say, hey.
Well, we do that anyway.
We do that anyway.
We've been doing that.
And there's been a shortage of CDLs across nationwide,
Right.
across many industries,
Right.
yeah.
We
Is
got
it
some
something
bad
where
ones,
we
too.
could possibly, because when you take the CDL class, kind of like BLET, where you sponsor the person going into the class?
We
Yeah.
would do that, yeah. I mean, if we had somebody that wanted to come in, we would hire them, take them through the training, and get them CDL certified to drive our trucks. Again, what we did in sanitation, and we've done some of that, has worked in sanitation, knock on wood, because we're 100% full. And that's, if you recall, I don't know how many times we came to you all talking about sanitation problems before 2024, so.
I only bring that up, if that works, fine, that's great.
Yeah.
But if it doesn't work, we need to look at that alternative.
Yes, sir.
And is this just for the hiring range, the 8,000 increase, or is it for the salary range as a whole?
Everybody's going to get a bump,
Yeah,
and the hiring range is going to go up.
the hiring range would be,
Yeah. I
okay.
mean, it'll get the scale right, so that where you fit in the scale, you still fit
Yeah,
in the
this
scale.
adjusts everybody that falls in this
Yes, that's what
range
that's
for
what I
their
was inquiring
experience
about.
and for-
I want to prevent
Yeah.
pay
Well, I mean,
compression
it's-
and complaints from.
It basically,
It's a
Yeah.
no-brainer. I mean,
not
we gotta
exactly,
do
but
it.
bumps everybody up $8,000.
Okay.
He's not getting hired.
I mean,
Right,
we're
exactly.
competing with the private sector and the other towns, and we're losing because we can't staff our places. So we got to do this to compete. I mean, it's a no-brainer. We have to do it, but who knows? Maybe there'll be new and innovative ways to pay for it in the future.
This isn't the first time we ran into this, trust me.
I know.
Well, I'll just tell you, as an aside, it's coming again in other departments. We're 5 or 6 years out from, you mentioned it this morning, Mr. Chairman, our salary study. And so, every 5 to 6 years, we have to do a salary study to get everything realigned, and we're getting to that place. So, not this year, but it's coming.
Right.
It'd be different if we were out in somewhere where the cost of living is so high. I mean, we gotta compete with that too.
So does this, bump, how does that compete with the municipalities? Does
I
that
think
put
it
us in
puts us
line?
on par.
Puts on par.
Puts on par.
Yep.
So even if I were to leave, say Dare County, go to Calover Hills, it'd be the same amount of money?
Essentially, I mean, if you test me, is it to the penny? I think it's
Well,
going
no, I'm not
to
saying
depend on
to
how
the
long
penny.
you've been where, but yes, it is competitive with them. That was our goal, was to not incentivize them to leave.
Right. I was thinking the other way, incentivize them to come back.
That's possible, and we actually did have that conversation, and I think Shanna told me that she knew of at least one that would consider that. That did in fact happen when we did it with sanitation way back in 2024. A guy that had left came back because.
Or at least promote some of the other guys that are, the other truck drivers in the town, say, hey, I can make a couple more dollars over here.
We haven't, when your salaries are right, it's hard to move long-term people.
Yeah.
But people that, a guy that may have gone last month that liked it here, but just for his family could get $8,000 more somewhere else, he didn't really have a choice. And so if he liked it here, he would come back, yes.
Give them a T-shirt.
Exactly.
All right. You need a motion?
Yes, sir.
So moved.
Second.
There's a motion on the board by Commissioner Balance. It's been seconded by the Vice Chair, House. Any further discussion? Hearing none, those in favor of the motion signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
At the last board meeting, you all asked me to find out about the Shoreline Stabilization at the Hatteras Medical Center, and Dustin has done that. And Dustin, I'll turn the podium over to you.
Good morning, Dustin.
Good morning, everybody. As Bobby had mentioned, during your January meeting, there was a conversation about some shoreline stabilization efforts at the Hatteras Medical Center. So I went out, I've got some quotes on what that would look like. Turnkey, it includes the design and permitting that would be required to place approximately 200 linear feet of riprap along the Hatteras Medical Center property. So in front of you is a couple things. If we want to move forward with this, the overall cost comes in at just about $65,000. Again, that's turnkey for design and permitting, as well as the equipment and material needed to place that. There is if you want to move forward with it, there's also a resolution that we would need to adopt exempting Dare County from the mini brooks. That would allow us to go directly to an engineering company or a consultant company to do the design and permitting for us without doing the competitive bidding process. So if you all are in favor of moving forward with the shoreline stabilization efforts, I would need you to approve that as well as authorize the county manager to sign and negotiate the proposals before you.
And you'd have to also authorize me to take those funds out of the contingency.
Well, I got a question. We got to have an independent engineer come in?
Yes, sir.
Sign the project and then have, obviously, I see the bid here for the $39,650.
That's one and
Those
the same.
two companies would work together in doing this?
That's the same company. That proposal in front of you. Well, I'm sorry. Yes, sir, you're right. The $39,000 is for the material and equipment, and then that company would work with the engineering company to make sure everything is placed according to the permits.
Okay. Okay.
Guys, I think this thing is needed. I will make a motion that we take the suggestion of Dustin and also give the manager authorization to sign.
Motion on the floor by Commissioner Bateman.
And take it out of contingency fund.
And take it out of contingency.
Is there a second?
Second.
Second by Commissioner Burris. Further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Thank you.
Thank you.
Item 12 on the agenda, you've got some notes in your file, but I'll give kudos to Commissioner Balance. She's been working on this for a long time. I mean,
3 years.
we've walked the property, we've walked the adjoining property.
You've been on the board 3 years.
I was started on it when I was on the Board of Ed.
I know that. I know that.
We went across the street and walked, and we've done a lot of things trying to figure out what we could do on a limited site to deal with parking. And there's no easy answer that lay people can figure out. If Mary Ellen and I could have figured it out and Dustin walking the property, we would be building the parking lot now, but we couldn't do that. And so if we're gonna try to improve that over there, we've got to get an engineer out there to take a look and see if there's a plan. There's really only 2 places where you could do it. One's across the street, and we have some wells and some things over there that make it where that's not possible. And the other's along the existing property line, but there's a big drop-off, I mean big, 15 or 20 feet drop-off from the parking lot down.
Man, you're wearing that out today.
I know, it's sensitive today. There's a big drop-off there, and to build a parking lot, we'd have to figure out how we're going to deal with that drop-off. And so to move forward, we're going to have to get an engineer out there to take a look and see if that's even feasible, and to try to then put some numbers on that to see if the cost is, if you're going to get 5 parking places, then you're not going to spend a huge amount of money to do it. If you can get 25 parking places, you might be willing to spend something because that solves some problems. So anyway, he's going to take a look at the site, see what we can do where, and maybe improve the parking out there is what this is proposing.
So just $24,000 to have an engineer to go take a look at it.
That would be correct.
And I want to say that, so the letters that you've gotten are some people that are frequent that area. I also went to the sheriff's department, and the sheriff's letters from the SRO at the high school. And it's really a miracle that there hasn't been an accident yet, because there's people parked on both sides of the road, up and down, whenever there's something going on. And it's just, there's kids shooting and darting in between those cars. And I really am shocked that there hasn't been an accident on that road. Buxton Back Road is a tight road anyway, even with the sidewalk. There's people parking on the sidewalk, which is going to cause the sidewalk to break. But I think this is something, it's definitely a step in the right direction. We do have teachers and, that live there that have to fight for their parking spot when they get home because people are showing up for the game. So that parking lot has been kind of a headache for a long, long time. And it actually came, the idea actually came, kudos to Danny, pulled me aside when we were meeting over the soccer field, and he said, if you guys could figure out a way to take this out, this could work. So like I said, this has been something since then that we've been kind of looking at and been trying to figure out a way to navigate, and we've got it to this point. So I appreciate y'all's support on this. If we can get this passed, I will make that motion.
Commissioner Balance, I will say, if you'll make the motion, I'll make the second.
I will make that motion.
And I will make the second.
There's a motion on the floor and been seconded. The floor is open for discussion. Dustin, when you have this cost to permit, design, and bid the project, look at the design, because I've been out there. There is some room at the widest part of it's a pie shape, really, is about what it amounts to. Because there's a fence in that ditch going down there, and it's almost like a pie shape. The further north is the widest part. There is room even further beyond that possibly could be used for parking, because there's a pretty good distance there between the end of that ditch or whatever it is to the actual field. And I'm wondering if some of that area could be used as parking as well. You know
Yes,
what I'm talking
I know,
about?
and there's even a little section where a fence comes out
Right.
that makes for awkward, that whole parking area
Right.
could be
And my
reconfigured.
point is, don't get them just to look at the ditch.
Yes, sir.
Get them to look at the north side of that widest part of the ditch.
I will.
Chairman, we'd ask him to be broader than that. I'd ask him to look at the site in total and say, how can we
Get the most amount of
improve
parking
I mean, there could be some things we could do to reline the current parking lot a different way.
Right.
We
Yeah.
could go to the place you just talked about and add some places. Is there a place somewhere else that would fit? You get 5 here, 6 there, all of a sudden you've done
Right.
something. So we would ask them to look at the whole
I
site
mean,
and see what
even
they could do.
even the existing parking, you could expand that before it gets to those bleachers, because you still got some room there.
Yeah.
That's right.
So
Yes,
I'm
sir.
glad they're looking at the whole site.
Yeah, we will. And
Thank
we'll
you.
come back to you all before any decisions are
Yeah.
made to show you what we've came from that.
All right. Any further comments? Hearing none, those in favor of the motion signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous. Thanks, Dustin.
Yes, sir. Thank you all.
All right, item 13 on the agenda is the beach nourishment model and update, and Matt's going to make that presentation. And he's going to do two things. One is, over time, our beach nourishment model, we've worked on it, and now with costs going up and things changing in the beach nourishment world, those models are getting pressure and getting tighter. And so I've asked Matt to, look at the model. He's spent now a couple of months refining it, making sure assumptions make sense, so on and so on, to make sure we have a model going forward, make sure we can try to continue to do what we're doing. And I'll just tell you, it's getting harder and harder and harder, as we talked about last night down in Buxton. So he's going to take you through some of that today. He's also going to ask you, the model indicates an amount of money that we need to fund for the Nags Head project, and you just got to formally approve that. They've gone through their approvals and gone through us, and we've shown them how it all works. And so, but they're going to need your approval on that at the end as well. So with that, Matt, I'll turn it over to you.
Thanks. Okay, so the beach nourishment model is funded by our occupancy tax, earnings on the portfolio, grants that we've received, a small property tax allocation from Buxton and Avon. So that goes into a fund which supports the projects for the towns. It also supports annual allocations for fencing and some of the dredging work that we do. As you know, we're working towards a repair of the groin. There's limitations on how we can use occupancy tax specifically, and it is for beach nourishment and not for the groin repair. So one of the things that we've done is proven that the fund has made over time enough money in investment earnings to support that repair. But as we think about future hardened structure repair, we have to think about the capacity of that model. So that's just another headwind that, as Bobby mentioned, on a model that's already stressed. So we prepared this slide in advance of the bid openings and prior to the rescheduling of the meeting. But what we wanted to highlight is the dependence on this FEMA approval for the Buxton and Avon project. So at the time that we did this slide, using the Nags Head numbers, we were anticipating a FEMA contribution amount of around $22 million. Now that we have some better information from doing our own bids, that number is going to go up to closer to $28 million. So because they're paying their proportion of the sand replacement. So it's just to say that if we don't get that FEMA money, the size of the project is going to be severely limited, and we're doing a lot to really evaluate what we can do if we have to go to that plan B.
Matt, it says we will place 1.5 million cubic yards less sand.
Yeah, so using the...
Out of the total cubic yards of how many millions? Do we know that, Bobby?
Well,
I'm trying
I'm
again for
reluctant
context. Is this?
Yeah, let's say it's 50%, but, because I think...
I'll share with the numbers that we shared last night. So
Okay.
all right, so ignore that for the moment, because that assumes if we had Nags Head pricing, we had the ability to put excess sand, which would have required a permit modification to get excess sand, which would get us to that kind of number. So we're not going to be able to do that. So the permit right now allows 2 million cubic yards of sand in Buxton and about 800,000 cubic yards in Avon. And that's with the FEMA money and our money together, right?
Yeah, permits 1 and 2, but yeah.
Step in when I get it wrong.
All right.
If we don't get the FEMA money, then we would have to reallocate those numbers, and roughly that would take us down to the minimum we could really do in Buxton to make it a viable project would be right around 1.3 million cubic yards. We asked them, their calculation is that if we did 1.3 million yards, that's more sand than what eroded during that time, and it could be a viable project, but you'd be on the margins at the end. And then similarly in Avon has the ability, in theory, we didn't really need to do Avon now. We could have waited a year to do that.
Yeah, but the placement says it's economic to do it.
But economically, you can't mobilize twice, and so you just did it as a part of this program. So if we put like 300,000 down there, then we can make that go. And stretching the model, we think we have, and I'm using think because I don't think Matt's finished yet. We believe that we can make that work without the FEMA money and still have viable projects.
That's wrong. I probably should have remembered the numbers from last night, and I apologize that I didn't. I was trying to get a context, Matt, of if we have X in terms of now 2.8 million cubic yards in the two projects, this would cut it in half. Are they still viable beach nourishment projects is my basic question.
The answer is if we can, if as we now think that we have enough funds in the model to do 1.3 and 3, then yes. They are viable projects and we can do it.
I mean, physically viable, that is a prudent use of funds to do a nourishment project that isn't washed away in 6 months and we have nothing to show for it. That was the question I was trying.
The question you need to really ask is, will those projects are designed for 5 years. And as hot as that spot is, we need to look at readjusting the model, because personally, as hot as that area is, I don't see that happening in 5 years. I see it happening in less than 5, perhaps 3.
See, we're digging into what are the criteria for a quote-unquote viable model, not financially.
That's right.
But physically on the beach. What do we consider? Typically, I would have said 5 years.
What we asked was, I asked specifically, I said, if we have to reduce this to the 1.3 number, is it going to last 5 years? And by lasting 5 years, I'm saying, are we, so that we are not in the position that we're in today with houses falling in the beach. And he says if the erosion rates for the next 5 years do what they've done for the last 3 or 4 years, then yes, it would last 5 years. If those erosion rates increase or change, then they would not. But they're putting more sand on the beach than the amount that eroded in the last 3 or 4 years. And so they think that they've captured the current erosion rate. They're not using erosion rates from the first project, which were better than the erosion rates that we're getting now. And that's all the certainty that you can get.
Yeah, I think the groin is also a variable that they're counting on will extend the life of the sand. I'm just going to give the caveat that these are all back of the envelope calculations, and we're going to be bringing to you real numbers.
I understand.
So let me ask this, Matt. If we don't get the FEMA funds, you're telling us we cannot do the project as bid, right?
So
the model, our funds will not allow that model.
We bid it.
We bid it with the.
We bid it both ways. So.
I know you did, but I'm.
Yeah, I mean, if we do not get the FEMA funds, we will likely have a nourishment project that will barely make the objective of the 5 years. And that's going to put a lot of pressure on our model.
On the model?
Yeah.
Okay.
So we're going to be, if that is where we are, we're going to be going through with you with some real science and some real numbers.
We're coming back to you in March because we haven't given any notices to proceed. We haven't done anything while we're figuring all this out. In the meantime, we're working with the folks at the state to find out and get some idea about the FEMA money. And I don't know whether we'll have that by our March meeting or not, but we're trying to get FEMA to tell us, yes. Up until now, we've been told, no guarantees, we can't promise you anything, but there's nothing that tells us that you're not going to get it, and they have funded other projects similar to this in other places. And so we're cautiously hopeful, but who knows? And so we're pushing all the buttons and trying to get all the people, the players in line.
I'm with you, Bobby. I'm more optimistic we will receive the funding than not. But again, absent the absolute certainty, We don't know for sure, but I'm pretty confident.
We're going to come to a place where, and the chairman asked about that last night, where we have a decision. We got to go a go, no go. I mean, at some point, if we don't know about the FEMA money, we've got to tell the contractor to get ready to come and start working or not, and then make the decision on are we going to do the smaller project. But that's not for today. That's just what's coming. That's what's looming out there, and so that FEMA money becomes critical.
And if we're in a position because obviously it's a seasonal thing, that's why there's a deadline on it. Come the time of that season, if we don't know about the FEMA money, we're gonna have to do the smaller project. We can't take a gamble on the bigger project if we ain't sure.
Well, it's a gamble either way. That's right. Yep. Exactly. Yeah, we can't take a gamble for that because we can't. No. We can't pay that debt if we are wrong on that.
The problem is we're potentially putting a Band-Aid on a bullet hole if we do the smaller project.
Yeah. I heard that was projected. There was more sand that went in. I hear what you're saying, but I heard you also say that's more sand than what was placed last time.
Yeah, it's exactly the amount of sand because the bid is based on the storm.
See, that's what I was driving at. Are we
getting
going
us
to be
back
a
to
Band-Aid?
pre-storm.
And I heard no,
but
it's not as certain or comfortable of the margin at 2 million cubic yards in
We
Buxton.
better hope that groin is a bad news groin. Stacks it up down there.
If you'd like, I'm getting you off track. Some of you were at the meeting, some weren't, but just, we got all of our permits for everything except from the Corps yesterday. So we've got all the state permits for both nourishment projects and the groin. We've got the National Park Service permits for both projects and the groin. And we're just waiting now for the
just gonna have to wait and see what happens
from the Corps on that. So everything's heading in the right direction, assuming we get the FEMA money.
So this is just an update. You don't need anything from us.
Don't need anything on that issue.
No, you don't need anything.
No. It fell into place with what he was telling you, so it was a good time to give you some context.
Yeah.
I'm sorry, Matt.
No, it's good.
Thank you, Matt.
Yeah, we want everybody to leave knowing how vital this FEMA money is. So, all right. So the beach nourishment model. This is the next slide. As Bobby mentioned, we started an exercise to formalize how the model determines the amount available for the town projects for the purposes of making sure that we have the funds for the future projects, but also to allow them the ability to plan for their projects as knowing how much that they will receive from the county. So the first town that we have done this with is Nags Head, and at the end of this, we're going to ask you for a vote. So their project is ahead of ours, and they are awarding their bid at their next meeting. So the framework for the model is to use a baseline project for each town. That determines their allocation. I'm going to probably need Bobby to correct what I'm about to say, but that was set when a tax rate was established within each town. And so there was an element of fairness to that initial project. And so that is the baseline. Then that size grows with the growth of the fund. So as the fund grows, their allocation will grow. We're using a model that's similar to an endowment model because the revenues of that fund go up and down. We want to have a consistent allocation, right? And so what it's basically doing is averaging out that return over time so that the towns can count on the amount of money that they receive. So one of the other things that the towns have done historically is, in addition to getting a direct payment, they've also received a subsidy for their debt payment because they're borrowing for their side of the project often. We've come up with a way to allow them to allow us to say the dollars are X amount, and now you can go and do math and figure out if you want to take some of that as a debt subsidy versus as a direct payment. So they can take that formula with their financial advisor and figure out the best structure for the town. So this framework has been set Bobby and I are going to meet with the other towns, and eventually what we'll likely bring back to you is a model and probably a recommendation for a reserve. And obviously, this is all going to, like, we're testing all of this now with this Buxton and Avon project. So
when we started doing beach nourishment, to really put a lid on this, we tried to find a fair way to fund it. And when you start looking at Kitty Hawk and you look at Kill Devil Hills and you look at what was going on at the time, trying to say we're going to give everybody X per cubic yard did not work. The tax bases in each community were different, and they could afford to do more or do less, and so that did not work. So what we did back then, and the county manager and I worked it out, and then the boards all approved it, is we took the Nags Head project and we just negotiated a number. And I don't even know how the number was negotiated between the elected people, and came up that we're going to give you this much money out of the fund towards your beach nourishment project. Well, when you divide that number, whatever it was then, to their tax base, it meant that if the town was going to tax for the difference, it was going to cost them 7 cents per taxpayer. And then they could take that, if that 7 cent generated, $5 million, they could then say, we're not going to tax everybody to get our $5 million. We're just going to do the oceanfront owners or the oceanfronts that won back. They could get their $500, their $5 million, however they wanted to. But if you took it across the whole tax base, it was still 7 cents per taxpayer. So when we ran that model and ran it against the other towns and said, okay, other towns here are your costs. If you take 7 cents per taxpayer and make that the town's share, is there enough money in the fund to fund the difference with the county? And the answer was yes. And so the theory was every taxpayer in every community that gets beach nourishment is going to have the same burden of 7 cents. The town wanted to redistribute that burden among their taxpayers, then politically that was their decision to make, but it was a fair allocation of the resources. And so
7 cent ad valorem tax.
Mm-hmm.
Yeah, ad valorem.
Ad valorem. So that's what we did, and that was approved by everybody. And so the idea is that we put in assumptions for revenue growth, we put in assumptions for cost growth, you put in interest, you put in all the factors, and over time you continue to fund the towns at those shares. Two things happen. One is if you did that to Kill Devil Hills taxpayers would get no occupancy tax money because their tax base was so large that 7 cents would have covered their whole project. No one thought that was fair, and so we negotiated a number with them, and I think it took their contribution down to 5 cents per taxpayer, but everybody understood that was fair, that it wasn't fair to just zero Kill Devil Hills out, and so that's what we did there. And then there was a hiccup in 1 year in Nags Head that they did some things in their tax rate that reduced their revenue, and they found themselves in a hole and came to us, and because of where we were at that time, we had excess funds in the fund, and we funded that hole that they created and said, don't come back to us anymore to fix holes that you create. And so that got taken care of, and the fund could afford it. Well, so now we're at a place where costs are rising faster than the fund is growing, and so it's getting tighter and tighter and tighter, and we don't have excess funds to make up these anomalies that occur. And we also need to be in a position where we can give the town a way that they can figure out what to expect out of the fund so that they can plan, because they're going to have to plan what we've said is our policy and have for years, unless you all change it, is, first of all savings, if a project comes in under budget, the savings go to the fund, so the county share gets cut. Again, to try to make the fund grow to help everybody. That's the point. And so if you get a grant to do a project, you can use it for your project, but we're going to cut the county funding by that grant. Again, the fund grows. On the other hand, if your project costs or your project scopes grow and your needs are greater than what the fund projects, then the town has to come up with that. Because in the past, we said we didn't want to go in the fund and do it because we wanted the fund to grow in order to build more projects like in Rodanthe. But because of the way costs have done, now we're saying we can't give you any more money because there is no more money. And so if your project scope gets larger, if your costs go up, here's what the county's going to give you over time. No more, no less. And if your project costs more than that, then you've got to figure out how you're going to cover those costs because we can't. And this model is to give them that so that they can be planning. You know, Nags Head's doing a project this year, and then presumably in 5 to 7 years they're going to do another one. You got to start planning these things pretty quickly, and so they got to know. The towns are all doing their projects next year, and so they're going to be in the same place. They're going to want to know, what are we getting? How do we plan our taxes and our rates to make sure we have enough money to do what we want to do? And so we want to be in a place to give them that. And so Matt has been working hard to, again, solidify that model, get it there, and get it where they can look at it and figure it out for themselves, that every time they're talking about it, they don't have to call me or call Matt and say, hey, go run the model and tell me how much money I'm getting. They can look at it and know. So we're giving them some certainty there. The dollars are coming out roughly the same as we've always promised them. You know, we've used a base, and if you use one base versus another base, then the numbers come out different. But we picked a base, and that's the base. And so, again, I think when we get it done, we'll bring it to you and show you. But it takes into account those policies I just told you about, and it gives towns certainty to do that. And that's our goal.
What's really making it tough is our funds, the two cents occupancy tax. I mean, that's what we're gonna get. We don't see huge growths in that. And these projects are gonna cost more as we go forward. The last project was $8, north of $8 per cubic yard. Now we're pushing $13 per cubic yard. So we're going to continue to see those numbers rise per cubic yard.
When does it become economic for us to get in the beach nourishment business?
That's exactly right, Rob.
$20 a yard, $25 a yard?
Yep.
So there you go. So
it's a
somebody
good
asked
question.
last night a good question is, what's plan B when the pressure on this becomes so great that we don't have any more funds to help with the towns, and the towns don't have taxing capacity to cover that, and yet the beaches are still eroding. And that is why we've started this push. The chairman's done some letter writing and some phone calling and some stuff. Some of the rest of you all have talked to people in your legislative delegations. We've traveled and talked to the CRC, talked to the environmental groups, talked to everybody we can about coming up with tools other than beach nourishment to try to mitigate oceanfront shoreline erosion so that we can take some of that pressure off of that fund, extend the life of those projects, use less sand, do whatever we can do to, again, solve or mitigate those erosion issues, and at the same time do it in an economically responsible way. It's getting traction. It's now being, 5 years ago nobody would talk about it. Now it's being talked about. Now we've got senators in the leadership calling Bob, telling him he wants to talk to us. He wants to find a way to help us. We've got the CRC looking at it with their science panel to start looking at what rules do we need, what can we do, what can't we do, how do they work, all that kind of stuff. So that's good news. There are other UNC Wilmington's doing some work on it. UNC's doing it. You and I sit on a panel that UNC is working on that is doing it. So there's a lot of folks out there now saying, hey, this is a problem, not just in Buxton and in Rodanthe, but on the coast of North Carolina, and we've got to find some solutions, and we've got to find them relatively quickly. We may be good for the next 5 years. We might be good for the next 10, maybe, but when you start getting out past that, you're starting to tax our ability to pay for that stuff unless we get some other growth in our revenue sources. So,
Yeah, and stabilization benefits everybody from the top to the bottom, economy-wise. Not to mention, with a stabilized beach, we could potentially see decreases in insurance premiums instead of the discussing. I mean, obviously, we've heard out there to Raleigh, and Mike Cossey's been doing an excellent job, but there's been a lot of talk about crazy insurance premiums on oceanfront.
all right, Matt, I've hijacked you once again.
No, this is good. We're a team. So what our ask of you today, so we really wanted to just give you an update that this model is being developed, and we feel good about it. We'll be bringing it to you, but the ask for today is to authorize the allocation of $13,067,426 for the Nags Head Beach Nourishment Project from the Beach Nourishment
So
Fund.
moved.
It's for that, right?
There's a motion on the floor by
From the fund
Commissioner
into the
Ross. Is there a second?
Second.
Second by Commissioner Balance. Floor is open for discussion. I've had a conversation with the mayor. I know y'all have had conversations with the town manager. Have we resolved that?
I don't, you'll have to ask him. We've resolved it from our perspective.
Gotcha.
What we said was, and I told the manager, I said, look, I am happy to sit down and talk to you. I'm happy to look at it. If you think we've made a math error, if you think that the model isn't running right, whatever, we can talk about that. We want to do right. We want to do what we said we were going to do. I said, but if you're just saying you'd like to have some more money, then we aren't in a position to do that, and we're not in a position that we're willing to modify the model in a way that would get you more money if it's either to the detriment of other projects or to the detriment of the future of the model. And I said, so I said, from Matt and I's perspective, we've looked at this every way we can. This is what we can do. This is what we can afford. This is what the model shows. I'm happy to listen to any other perspective. And if there's a way that we can make it all work and still meet our other commitments to the other towns and to the villages down south, then we'll talk about it. And he said, I understand, and he haven't heard back. So I'm assuming that it's resolved. And they, what did they do, Justin? They gave the notice of award the other day?
Yes, sir.
Yeah, so they've accepted their number, but they haven't like signed contracts yet.
Got it.
They're waiting on us to do this.
It wasn't contingent on us.
No.
No.
Got
It
it.
was not.
Okay. All
This
right, any
is-
further questions of Matt?
I was just going to say, this is the number they are aware, this is the number we're
Got
bringing
it.
to you today.
Yeah, that's my point. Good. All right. Any other questions? Hearing none, those in favor of the motion then signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous. Thank you, Matt.
All right, stay right there, stay right there, Matt. This is the Dare County Capital Improvements Plan for the Dare County Schools Capital Improvement Plan amendments.
All right, so there's two amendments. These come from the CIP meeting. So as a reminder, the Dare County Capital Improvements Plan is funded by the land transfer tax and an annual general fund contribution of $9,825,000. So the first amendment for the Dare County CIP is to increase the budget for pickleball by $145,000. This is to provide a total budget that equals our half of the estimated $1.128 million project that we discussed earlier in the meeting. The amendment, what it's actually doing is increasing the revenue in the fund because our our land transfer tax did come in over budget last year, so it's effectively funding this increase.
Matt, real quick, just a clarification, Bobby. There was $500,000 in the CIP 24, of which 419 remains.
Yeah.
Did we, maybe I should remember, I don't. Did we authorize an $80,000 expenditure out of that for scoping or engineering or something?
Yeah, we've spent that amount of money over the time since that budget was approved, and I don't know if it was just scoping of actual,
So
Dustin may know.
Design.
So
Yeah, it was
before
design.
we went to the tourism board, we had to know what we were doing. So
Right.
we spent that amount of our money to get a plan to go to them with. We had for placeholder purposes, $1 million in the CIP to do
Yeah.
the project. When
Yeah.
we got
Dilution.
we got dilution, we got the plan, we got all that, we got the
Okay.
estimates. So
Yeah, I just wanted, I couldn't remember
It's-
what
Yeah,
we
that's
did
what-
with
It's
the-
it's a
okay.
little bit over $1 million that it cost, plus what we already spent.
That's all I needed,
Yeah.
thank you.
And we'll just do them both together, so I'll give you a quick overview of the school's capital improvement plan request. Again, the school model is funded by Article 40 and Article 42 sales tax, as well as some lottery monies. The Manio Fieldhouse is expected to be $1,630,170, which is $130,170 higher than what is in the model today. I have been working with Rashad and Ian, and we've been revisiting the CIP, and we'll probably bring that forward to you too, in the way that we'll bring the beach nourishment model. Bless you. But within that, we found some capacity. So there is also an amendment for playground equipment of $270,000. And so this playground equipment was in next year's CIP, but because we have the capacity in the model, and it's a priority to the schools, we're bringing it back to start it in this fiscal year.
Okay. So you need a motion on both of these amendments.
Yes, please.
Pleasure of the board.
So moved.
Motion by Commissioner Balance. Seconded by Commissioner Creef. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Thank you.
Thank you, Matt.
Jim, that brings you to the consent agenda. You have the approval of the minutes from January the 5th. You have the tax collector's report. You have the Boundtree Operative IQ licensing agreement, local fatality team 2025 report, a letter in response to the FDIC tick we talked about earlier, stormwater project budget amendment, night vision goggle service agreement amendment, budget amendment for the sheriff's federal forfeiture funds, a resolution authorizing for the disposal of certain personal property from EMS, a budget amendment for the Grants and Waterways NCDEQ beach access, Rodanthe Emergency Ferry Channel permitting budget amendment, Community Child Protection Team and Child Fatality Prevention Team, the annual report, and then the Government Access Education Channel's proposed 26-27 budget.
Motion to approve.
Motion to approve by Commissioner Bateman.
Second.
Seconded by the Vice Chair House. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Next are your board appointments. The first is the library board. The library board recommends the appointment of George Carver and John Watkins to the two vacancies.
Pleasure of the board.
Motion to approve.
There's a motion on the floor to approve by Commissioner Balance, seconded by Commissioner Bateman. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Next is your planning board. The terms of David Overton, who's an at-large member, Beth Midget from District 4, and John DuBois from District 2 all expire in 2026, and they all wish to be reappointed.
Motion to reappoint.
There's a motion on the floor by the Vice Chair to reappoint all three. Is there a second?
Second.
Second by Commissioner Balance. Further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Next is the Juvenile Crime Prevention Council. Sheila Davies has stepped down from the Health and Human Services seat, and the JCPC recommends that Chuck Lysette from Social Services be appointed to fill that seat.
I make a motion to approve.
Motion on the floor by the Vice Chair, seconded by
Second.
Commissioner Burris. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Next is the Baum Center the Baum Center Advisory Board. The Older Adult Services Nominating Committee recommends the appointment of Rosemary Kelly to fill the vacancy previously held by Antha Bishop.
Motion to approve.
Motion approved by the Vice Chair House, seconded by Commissioner Bateman. Further discussion? Hearing none, those in favor signify by saying aye. Opposed, like sign. Motion carries unanimous.
Those would be your appointments, Mr. Chairman. Coming up in March, you have the Transportation Advisory Board with 1 term. In April, you have the Airport Authority with 1 term, the Juvenile Crime Prevention Council with 1 term, the Mans Harbor Marina Commission with 3 terms, the Older Adult Services Advisory Council with 2 terms, and then in May, you have the Veterans Advisory Council with 2 terms and the Zoning Board of Adjustment with 2 terms. And that would conclude your agenda, Mr. Chairman.
Thank you, County Manager. That brings us to item 17, Commissioner's Business, Manager's Business. I'll refer back to you, County Manager. You have anything else?
Nothing new.
Not good. Great. Hey. Wow. Whoa, that's a first.
That's two in a row.
No, yeah.
He didn't have anything last time.
Wow. Public Information Officer, Ms. Hester, how are you this afternoon?
Doing well. I do have a couple of items. The State of the County breakfast meeting is scheduled for March 18th. Hopefully y'all have that on your calendar at Captain George's. I did want to let everyone know, and we'll be announcing this publicly, that the chairman's going to do a second presentation, the same presentation, on the Saturday following, which would be the 21st at 10 o'clock at the high school in Buxton, so that there's a Hatteras Island location. It's not a breakfast meeting. We'll have some refreshments, but doors will open at 9:15 with the presentation at 10, an opportunity to take it to the folks down there. So
We've done that in the past. It just helps Hatteras because we're limited up here. It sells out really, really quick. How many we have so far, Dorothy?
when I saw yesterday, we were at about 115, I think, was
Yeah.
the last number that
Yeah.
I saw. And we can hold about 217.
Yeah.
So,
It
we'll
goes
put a
pretty
out.
quick because we
Mhm.
just opened it.
I would think in the next week we'll be
Yeah.
filled.
And that's on the 21st.
Yes,
Yeah.
of March, that Saturday.
The Hatteras one.
That's not a breakfast one, it's just a.
No, that's
Yeah,
not a
Cape
breakfast.
Hatteras Secondary School
the
in the
other ones on the
auditorium, yes. So we'll get the word out. And we are asking people to register. You know, you don't have to buy a ticket, but
Right.
reserve a ticket so we know how many we need to plan for, basically. And I wanted to let y'all know, we announced that DARE A250 passport program, and it's getting a great response. People are, you know, you think this time of year, are people really going? But they're scanning, and it's coming through, and a few people have done almost all of those 13 stops. So we're excited about that, because I think we'll start promoting it more, and as visitation increases, it's going to be really well received. And speaking of the Passport online program, today, it just went out a little earlier, but kudos to GIS, that imagery that they have been capturing in Buxton and Rodanthe. There's now a drone map that shows that imagery so that folks are able to see the erosion that's taken place. So that is available. Kristen, I know, is flying that, you know, with the drone and capturing it, and then people are able to access that information to see what's happening. So that is there. And then the last thing I was going to mention was with the referendum going to the public for the Parks and Rec, we'll be putting information. I know, Bobby, you said we can only do so much, but we can present the information so that there's awareness about what those projects are. And I know Spencer had sent me an example of another county and what they had presented. So we'll work on getting that.
Yeah, I need to look. It's been a while since I've looked at it, but I believe the rules are you can't advocate vote yes or vote no, but you can put out all the factual information that you
Right.
want.
Yeah,
Right.
which is what we'll
You gotta
be
do
doing.
something so they make a decision.
Yeah.
Lots of pros and no cons.
Right. But, you know, FAQs, you know, what does this apply to, what's exempted, all of that information. I know the
Yeah.
one county example I saw, there was actually a calculator included, so people could figure out what it meant based on a certain cost. So we'll be working on that. So I wanted to mention
Super.
that as well. And that's everything I
Fantastic.
have.
Thank you, Dorothy. Appreciate it. Matt, do you have anything else for us?
Nope.
All right, thank you, sir. That brings us to Commissioner's business. Commissioner Balance, would you kick it off today?
I sure will. Couple things, lots have happened the last month, and actually 2 weeks into this month. I serve on the steering committee with the NCACC for general government, and they actually just did it was just a like 1 hour meeting about, it was on housing, and really talked about the statewide deficiency that's statewide with housing. 332,000 in rentals and 442,000 in sales. That number really stuck out to me as the 765,000 in deficit in needed homes right now. 442,000 in sales. So homes for sale, they're 442,000 in a deficit. Like that's how many we're lacking in available homes to purchase. I know.
Where? What's this?
Statewide.
Statewide. So, and we are a big state. I mean, North Carolina's a big state. But it just really struck me. And so we had our second meeting, our first meeting over in Southern Shores at the new location, and I saw the big town bank conference room. It's quite impressive. So we're moving towards getting in that building with the foundation. It's going really well. We're right on track, and everybody's, the separate committees are meeting. So big stuff is going to start coming out on that. We had another meeting yesterday on land trusts to talk about. We had someone come in and do a presentation for the board on how land trusts work and how they can be modeled and things like that. So lots of good stuff happening there. Waterways meeting was this past Monday, and a couple of things happening. DOT is pulling out of Stumpy Point. They've finished the work there at Stumpy Point and dredging that and getting that ready, and they're going to be moving to South Dock, which is the north end of Ocracoke. So that's what we call South Dock. I don't know why we call it South Dock, but that's what they call it. Because South Dock, you would think it's
South Dock on the north end.
Yeah. Hey, I just pay attention.
Why not?
I mean, I would think the South Dock of Hatteras, of Ocracoke Island would be South Dock.
Yeah.
But anyway, that's what they call South Dock. So the DOT dredge, and they're starting their projects down there. They're going to be fixing that roadway there. Bigfoot Slough, it's that's on the tap to be done, but they have found that we think they need to widen it more. So they're relooking at some of that, and may end up, they're doing a pre-construction meeting, and they're looking at some survey data to see about widening that. Rodanthe Emergency Ferry. We're still working on that. There is some, they're trying to figure out how to get the dredge to naturally connect to naturally deep water. So there's some permitting. The permitting that we're trying to get for that will include all dredges. So when you, and this is my learning in waterways, when you apply for a permit, you have to put what kind of dredge is going to be used. And so we're going to put that permitting for any dredge. So the Miss Katie would be able to go in and maintain it. Right now, it really can't get in there. So we're kind of, in a bind. But we're working that through, and that's going to hopefully all come together. Looking forward to the Polar Plunge with all my fellow commissioners that are going to join us. I want to thank Rob for entertaining all my crazy phone calls as he tries to explain to me how all this stuff works. I appreciate you so much. And that's all I got.
Thank you.
Oh, one more thing. Tomorrow's I have to do a shout out for my husband. Tomorrow's our 27th wedding anniversary.
All right. Congratulations.
Congratulations. Commissioner Ross.
Okay. Well, thank you for those kind words, Commissioner Balance. That was very nice of you. I'll be brief. I only have a couple of things. Last month, I made the announcement that the Outer Banks Thrive event gala was scheduled for February 28th. That was an incorrect statement. It is actually happening on March the 28th at Duck Woods. That is the ThriveOBX big gala disco theme. It's going to be a big, crazy night. So,
To the hospital.
yeah, it's for the hospital and Department of Health and Human Services in combination. St. Patrick's Day parade's coming up. Yes, indeed it is. It's that time of year again. Wearing of the green. March the 15th, big event. We should all be there.
We have a float. We have a float.
Yes, indeed. But we have to be on the float, not just have a float.
We get to ride or we got to walk again?
Do what?
The A250 float is serving as the Grand Marshal. And I should have given, do you mind if I
Please.
give a short update about the float? I
Absolutely,
didn't talk
Dorothy.
about it,
This
but
is the
we'll
floor
be
for me.
coordinating with you all. In addition to you all being on the float, there will be a youth choir singing patriotic songs. So there's two ends. It's a very large trailer. So there will be patriotic music with kids singing the patriotic song. So y'all will have some company, and I think it'll be fun to.
Fantastic.
And we've got, if you go in our office right now, we have boxes everywhere with decorations and candy and
Oh, boy.
beads and
Can Bob
all
and
the-
Bob and I sing along too?
absolutely.
Absolutely.
If you want, I can get the list of what the songs will be.
I just haven't heard how
and
good I
send
can
y'all.
sing.
Do you have Uncle Sam outfits for us?
I was
No.
gonna say, he should dress up as Uncle Sam.
Hey, I'll dress up.
You don't have Uncle Sam
Thank you for
outfits?
volunteering me,
Especially
Commissioner
if-
Balance.
We don't get to ride. If we don't get to ride,
No, you're on the float.
okay. If we don't get to
no,
ride,
you
I was
do-
about to say
you-
I'm gonna bring my horse and dress up like George Washington.
Oh,
I'll
no,
ride,
no, no,
I'll
no.
ride a
Y'all-
horse
y'all
across
are
there.
on
This
the-
car.
Y'all are definitely on the float. So sorry to interrupt. I just.
You can follow on the horse.
I'd rather ride the horse than walk.
That is okay. Next, Chief Collins. She's not here now, but let me tell you, I have nothing but admiration and respect for her. Congratulations on 10-year anniversary. We've got a heck of an EMS operation, and Bobby, I think you correctly stated it's one of the best in the state. It's fantastic. And the audit report, where's Mr. Matt Motika? It's fantastic. The no longer CAFR, but ACFR. The ACFR, yes. Very, very complex, but the story and the end are both phenomenal. A clean audit opinion, all of those schedules, all of the grants in terms of federal and state requirements, and the 34th year of excellence in financial reporting does not happen by accident, and you have my gratitude and highest respect for that. So well done, County Manager as well. Thank you.
Aquifer, isn't that where water comes from?
An aquifer is, but apparently a CAFR is no longer
That's what I
acceptable
know.
terminology in the
That's what I
United
hear.
States. So we're going with
That's what I hear.
annual financial comprehensive, or AFCAR. Or annual comprehensive ACFR, sorry.
Thank you, Commissioner Ross. Vice Chairman House.
Thank you, Mr. Chairman. In dredging news, the pipeline dredge at Old House Channel is working its way up on the northern end of the channel, and Army Corps gave an update, said that they should be finished with that project sometime within the next 2 to 3 months. Now, the problem with Old House Channel, and we've had several boats, trawlers that use that channel, have said that at times they cannot get through there because of the pipeline. And they've had to turn out of that channel or decide not to go to that channel and head down to Moorhead to come out. So hopefully, once that pipeline dredge is completed, we'll have trawlers coming, the Engelhard trawlers will be coming back through Oregon Inlet and stuff like that. So also with the alternate channel on Oregon Inlet, we have put in a permit modification to make that a 200-foot wide channel. All the state and Park Service permits are in. We're just waiting for the Army Corps to give us the okay. We'll see when that happens. Also, coming up on our fisheries, the North Carolina Department of Marine Fisheries will have their quarterly meeting here at the Hilton Garden Inn in Kitty Hawk. I urge everybody who can attend, please attend. Let them know we are really interested in our fisheries and we want to keep our fisheries open. There's not a whole lot on their agenda this time that really brings up a lot of concern. But one thing that I definitely plan on bringing up is the rockfish and striped bass. For the past 3 years, they've done it by proclamation to close the sounds for striped bass. However, you can fish for them in the rivers while they're spawning.
Crazy.
How does that make any sense at all? And with the management fishery plan on the striped bass, doesn't allocate for that, but of course they do have the emergency proclamation. How can it be an emergency proclamation if you do it 3 years in a row? Something needs to be addressed. Also, my congratulations to Chief Collins as well for her 10 years. Bobby, yes, Dare County EMS is recognized statewide. They have also been recognized nationally, and they've also been featured in publications internationally. So our EMS system has been recognized internationally, not just here in North Carolina. And that's a big, big feather in the cap for Chief Collins and everything that the entire staff of our Dare County EMS people do. And just kudos to her for hanging in for 10 years, and hopefully we'll get a whole lot more years out of her. So thank you for that. And the best part, favorite part of any commissioners meeting, meet our pet of the week.
Our pet of the week this week is Bolly. Bolly came into our care with her 2 puppies. She was an amazing mom, and now both her puppies have found their homes, and Bolly is looking for hers. This sweet girl is 2.5 years old and full of energy. She loves going for walks, playing fetch, and getting all the love she can. Give us a call if you would like to set up a dog meet with Bolly. To adopt Bolly or foster one of our other animals, come visit us Monday through Friday at our shelter located in Manio. For more information, visit our website at obxspca.org or visit our OBX SPCA Facebook page.
So please pick up a tennis ball and go down and see Miss Bolly and take her home with you and give her her forever home, and I'm sure she will love you for that. Mr. Chairman, that's all I have. Thank you so much.
Thank you, Vice Chairman. Commissioner Bateman.
Sir, Bobby, have you heard any more on Brightspeed as far as the contact?
Yeah, I've got issues too.
I think everybody up here had issues.
Yeah.
Good luck. I've reached out to their public affairs person, and he's going to reach back, and we tell him, but we haven't had any, other than what I sent you, there's nothing, and that didn't really tell us anything, so I don't have anything else to add or tell you or have anywhere else to go. I mean, I don't know who else to talk to.
That's just it, because I've got a person I'm trying to help too, where they ran a line through his property without his permission.
Right.
Same here.
Right, it's same person, both of y'all.
It is?
Both of y'all been working.
Yeah.
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 Well, I got more than, I got one in Wanchese and I got one in Hatteras. I mean, my concern, and I know it's everybody's concern here, we have a public utility who got taxpayer money to do this big expansion. And I don't think once they get here and get the fiber optic hooked up and everything ready to go, they have the capabilities of servicing the people that they have even now, much less the new
If
people.
you all have phone calls or issues that people are bringing to you, if you will send me the name, and I need the address of where the problem is and what the problem is, I'll get them to this guy. I can't tell you what there's going to do with them or what they'll do them, but I will get them and bird dog him to at least respond or tell me don't send him any more emails, one or the other.
I'll have you that information in about 2 minutes.
Sure.
Can we get him down here so we can get him on that podium and tell him what an idiot he is?
I asked that.
We've tried that several times.
Well, if you recall, I asked that in the email, and the letter that he sent back didn't respond to that request.
Yeah,
Okay.
we've tried.
All right, on a positive thing, we had recovery court graduation on the 17th of January. We had 11 graduates. Guys was really, really good. Some of them have gone on to get really respectable jobs, getting married. At the graduation, we had families there. Mom and dad came. They brought their kids. It was a very, very emotional for me. graduation.
We have
The judge-
CDL openings for them.
I'm sorry?
We have CDL openings for them.
And listen, and I agree 100%.
I'm
I was
not
thinking that
kidding.
when Bobby was saying I was
I'm
on.
dead serious.
Yeah, it'd be a great avenue for them. We've also expanded, and I'm part of the Saving Lives Task Force, and we have created, thanks to Bobby and some creative accounting, we've got a physician who is serving the recovery court now. So we have one doctor serving all the people there. The problem we had before, they were going to different doctors in different areas. Some people had 3 doctors, and they were prescribed. Now we only have 1. We also have a psychologist. Also, we have that same psychologist and doctor that's going into the jail, which is really, really great because they get to get administered their medications there. From the jail, last year, we took 30-plus people that were incarcerated, took them directly from the jail into long-term treatment, and then brought them into recovery court, and then followed them, and also, because the peer support specialists helped them get into halfway houses and get on with their lives. It's really important that you follow these individuals into their recovery throughout the time, not just let them out of jail and let them go because they're going to relapse. So that's really, really good there. Jenny, she's a rock star. I mean, guys, we all know she's doing a great, great job. And Matt, thank you for being doing a presentation that I can understand. Appreciate it. Thank you.
Hey, thank you, Commissioner. Commissioner Cree.
All right, well, starting out, we'll start with the fishery stuff. Obviously, Steve just referred to the meeting. One major concern I have in the fisheries right now is obviously they announced a week ago that they were going to once again close down the speckled trout fishery in all inner waters until June 30th for the second straight year. I have a few problems with this that need to be addressed not only at our Coastal Coalition meeting, but at that Marine Fisheries Quarterly meeting. Number one, there's no due process in that decision making. They just flat out 2 years in a row, no public comment, no one to go and give a counter argument to the shutdown. They just close us down for 6 months out of the year, 2 years back to back, and the only thing they put up on their page was a couple pictures of a handful of frozen trout in a couple of very shallow water areas. They haven't done a stock assessment before they made that decision. They don't know how many trout went out in the ocean and didn't freeze. They have no idea how many trout actually died during the freeze. There's no data. They just have put a couple pictures up and say you're done for 6 months out of the year. And economically, that hurts all of our commercial fishermen who are inshore fisheries. The 75 trout per day limit is one of the biggest financial boost to our inshore fishermen during that year. Like last year, we weren't allowed to keep trout either, and you almost had to try to get away from the trout. There were so many in the spring. And then they left and went in the rivers in the fall, so all of our fishermen here in the eastern part, the coastal sounds, didn't get a trout season last year hardly at all because they were all here during the spring instead of the fall. It really makes me angry that they would just shut down 6 months of a year with no input from the fishermen at all, with no due process whatsoever. And moving forward, I'd like to see some kind of legal explanation for that. Maybe we could have a suit of some kind. Secondly, the new appointed colonel of Marine Fisheries, a friend of mine, Chris Lee, he lost his yellow Labrador a couple weeks ago in Collington. I'm sure you've seen it on Facebook or anything, but I'd like to address that. If anybody has any information or anything regarding his dog, please come forward because that's a big deal. I mean, I carry my yellow lab to work with me every single day. She's waiting on me at the shop right now. So, you know, that's a heartfelt thing there. Please come forward if anyone has any information regarding that. Thirdly, Matt, that was an excellent presentation. The numbers are looking good. You've been in here, what is it, almost, when's a year for you?
Not until May.
May. So we're coming up on your year. I just want to say you're doing an excellent job. That was a fantastic presentation, and I hope that people really look at these numbers in our county and start to get a grasp on what kind of position we're in. This board's done an excellent job, certainly in the past. I mean, that's nothing we did recently. That's starting in 2016, 2017, you see where our numbers went on such an upward trend. So please take a look at that. Thirdly, or fourthly, obviously, everybody probably saw or heard about my arrest on the news. I'm going to own it. It happened. So now the question is, what do we do from here? Well, I don't want any pity. I don't want anything. All my decisions are mine and my own. Self-reflection. I'm going to make outward and inward strides to rectify this situation. I can only ask you for forgiveness now. A man told me one time it takes 30 years to build a reputation, and it takes 30 seconds to tear it down. Hopefully, in time, obviously it's not going to be today or tomorrow, but in time, I'm going to try to turn this trial into a testimony, into which maybe one day down the road, I can help somebody else who's in a similar situation. I will have to deal with the consequences of my actions personally and alone. And I'm truly sorry to my constituents, my church, and my family. But we're going to move forward. We're going to continue to do everything in my power to make this county an excellent place to live, strive, and raise your children. And I am sorry.
Thank you, Commissioner Creed. Commissioner Burris.
I want to start off by saying, it's fitting that Chief Collins was here today for her 10-year pin. I know you all received the email that I received with just the outpouring of compliments that they've received over the last couple months. What you probably didn't see is one of those compliments was mine. In the past month, I have walked into my mother's, and she was laying face down in the living room, unresponsive. And you talk about a scare, and I was terrified. And I immediately, called 911. My nephew was with me. I said, run to her pocketbook, get her card out with her medications on it, so when they get here, they're prepared, and got her to sit up. She had a high fever of 104. She had an infection, and she had the flu all at the same time. And she had just lost energy and fell. They were there in a matter of 6 or 7 minutes. And I'm down in Wanchee, so the local response was from up here at the Foodorama, from that station there. So they got there as quick as anybody could have got there. They were professional. They just handled the situation smooth, perfect. We are so lucky to have her leadership in that department and the wonderful folks that work under her that just are committed to doing a fantastic job for our community. It really is an asset, and I want to give a shout out to Hannah, Anna, and the gentleman's last name was McKinney. I can't remember his first name. But thank you so much. It really meant a lot to me personally, and I know it means a lot to everybody else in this community that has had need of the EMS services, over the past 10 years that at least Chief Collins has been in charge, and just what a fantastic asset she is to our community and the department as a whole. So I wanted to personally give them a shout out and thank them, and it was just very fitting that she was here today for her 10-year pin. Secondly, I look forward on a lighter note to the Polar Plunge. If you ain't plunging, you're paying. Remember that. So I know some of you say you're not plunging. Pony up the money. Come on out of pocket. Y'all can afford it. Most of you are retired. I'm sure you got a little extra coming in on the account. You can pay out a little bit for the folks. And we're gonna enjoy that. We're gonna be the Freezing Friends.
Yeah.
Freezing Friends team. So when we plunge too, you got to go in all the way, head to toe, head to toe.
That ain't what I've heard. That ain't what now I have in the past. It amazes me how these rookies want to really ride us old guys that's done this probably 10 years in a row. And because we don't do it once or twice, these rookies are giving us a hard time.
Mm-hmm.
Now, every time I've ever done the polar plunge, I have not been in a wetsuit, and I have not gone up to my knees. I've had a bathing suit
due to
on
the
and
inherent
dove
risks
in.
of
Now, he
cold
uses
water,
the excuse,
we have
well,
to
the
protect
police
our
have
chair.
stopped us back
Our
and
chair
held
is
us back.
placing himself at risk by plunging cold water. Deputy, I'm going to ask you to speak to the chief.
I'm going to start
to the
challenging
sheriff.
them to a basketball court and see how long they can run up and down a basketball.
In a wetsuit.
In a wetsuit.
Okay.
I don't think I'd make it too many trips up and down the court. Thankfully, I coach a 14 and under team in basketball, and I let them do the running. So, but it is a lot of fun. Even if you can't jump in the water with us, show up, give, donate. It's a wonderful cause. Shout out to that whole crowd, Sandy and Miss Mary. Fantastic job. The kindness. We have so many people in this community that give back. And the kindness they show and the love they show it's a wonderful thing. We're so fortunate here in Dare County to have all of the people that we do that give back. So I just want to point that out, and I do look forward to that. I look forward to the A250. I'm going to try and get around and visit, 13 locations? I'm going to try and get around and visit all 13 of those and encourage others to do it and get out and better know the area and understand the area and the history of the area which we live and which some of us come from. So it's a fantastic event. I look forward to that. And I will promise you I will not sing on the float. You have nothing to worry about. I can't carry a tune in a bucket, so you won't have to worry about me ever singing. So other than that, we do have a election coming up on March 3rd, a primary election. I encourage everyone to get out and vote. A lot of people have fought for our freedoms here in this nation. We have a free election here, and we are the greatest nation in the world. And there's a lot of people who have fought for that, and we need to show them that we respect what they've done for us by getting out and exercising our freedoms and our right that they fought to protect over the generations. So I'm a big fan. Get out and vote. I don't care which way you vote, just vote. Make a use of your rights and your freedoms, because the days we start giving them up is when they'll start taking them from us. I can guarantee you that. So get out and exercise your right and enjoy the day. Stop and talk to your candidates. And then lastly, I just want to commend the 6 people I work with up here and I hope the general public understands and sees the broad range of things that everybody on this board works for, and the seriousness with which we take the job and how we try to come about with the best possible outcome at the least possible impact to the citizens here in Dare County. And in my year and almost a half on the board, I can't say enough good things about the professionalism and the work being done by my 6 coworkers up here on this board. And this has been an honor and a privilege to serve with these folks and to be able to serve the citizens of Dare County. So I want to thank you all for that, and I want to thank my coworkers up here for that. You guys do a fantastic job, and your commitment is second to none. So thank you.
Thank you, Commissioner. I appreciate it. With that being said, we need a motion to adjourn until March the 2nd at 9 a.m.
So moved.
Motion by Vice Chair, seconded by Commissioner Burris and Balance. Any further discussion? Hearing none, those in favor signify by saying aye. Aye. Opposed, like sign. Motion carries unanimous.